Honourable members, please be seated. The Honourable Minister of Labour and Immigration.
Thank you very much, Mr. Speaker. I rise to seek unanimous consent to waive Standing Order 39-1D to seek leave to introduce Bill 71.
Honourable members, I will ask only one question. The Minister of Labour and Immigration has asked for unanimous consent to waive Standing Order 39-1D. I will ask only one question. Is there anyone opposed? If so, indicate now. Unanimous consent is granted. The clerk.
One more.
The Honourable Minister of Labour and Immigration.
Thank you, Mr. Speaker. I rise to seek unanimous consent to waive Standing Order 8, subsection 2, to revert to introduction of bills.
Honourable members, the Honourable Minister of Labour and Immigration has requested unanimous consent to revert to the introduction of bills. I will ask only one question. Is there anyone opposed to granting unanimous consent? If so, indicate now. Unanimous consent is granted. The clerk.
Introduction of bills.
The Honourable Minister of Labour and Immigration.
Thank you, Mr. Speaker, and thank you, colleagues. I rise to request leave to introduce Bill 71, the Employment Standards COVID-19 Vaccination Leave Amendment Act. Albertans across the province who want to get the vaccine will not have to choose between putting food on their tables or their health. We are protecting lives and livelihoods so all Albertans can contribute to the success of our economic recovery. If passed, this act will take effect on the day the bill receives first readings. Mr. Speaker, I am pleased to move first reading of Bill 71, the Employment Standards COVID-19 Vaccination Leave Amendment Act, because this is the right thing to do.
The Minister of Labour and Immigration has moved first reading of Bill 71, Employment Standards COVID-19 Vacation Leave Amendment Act 2021. All those in favour of the motion for first reading, please say aye. Aye. Any opposed, please say no. In my opinion, the ayes have it. That motion is carried and so ordered.
Bill 71, Employment Standards COVID-19 Vaccination Leave Amendment Act 2021 is now read a first time.
Honourable members, I believe the Honourable Minister of Labour and Immigration has another request for unanimous consent.
Thank you very much, Mr. Speaker. I seek unanimous consent to waive Standing Order 77, subsection 1, in order to proceed to second reading of Bill 71.
Honourable members, the Minister of Labour and Immigration has requested unanimous consent, which provides the House the ability to move immediately to second reading of Bill 71, the Employment Standards COVID-19 Vacation Leave Amendment Act. I will ask only one question. Is there anyone opposed to providing unanimous consent? If so, indicate now. Unanimous consent is granted.
Under Government Bills and Orders for second reading, Bill 71, Employment Standards COVID-19 Vaccination Leave Amendment Act 2021, Honourable Mr. Copping.
The Honourable the Minister of Labour and Immigration.
Thank you very much, Mr. Speaker. It is my pleasure to rise and to move second reading of Bill 71, COVID vaccination leave. Mr. Speaker, since the beginning of this pandemic, Alberta's government has taken bold actions to support our province through this very challenging time. And we continue to take bold actions to protect Albertans' lives and livelihoods because it is key to the success of our province's recovery. On April 20th, we saw Albertans 40 years and up booking appointments, going to walk-in clinics, and getting their first dose of the COVID-19 vaccine. They did this on their own because they realized we all have a part to play in this fight. Albertans are hardworking and they deserve a government that continues to take bold actions to protect their lives and livelihoods. By introducing this legislation, we are making sure that every working Albertan keeps their job, gets paid, and can get vaccinated if they wish to. They will not have to fear reprisal or penalty or worry about how they're going to put food on their tables in order to do their part in the fight against COVID-19. Our neighbours to our left and right have introduced similar leaves to support the rollout of the vaccine. And with the rising COVID cases and expansion of the vaccine program, it makes sense to create the opportunity for more Albertans to get vaccinated. That is why, if passed, this act will take effect on the day the bill receives first reading to ensure all Albertans can work with their employers to schedule time away to get a shot that could save their life and protect others. Mr. Speaker, since March 2020, we have been doing everything we can to create opportunities for Albertans to protect their health, and this leave is one other measure to support Albertans' health and our economy. So thank you, Mr. Speaker, for the opportunity to move the second reading of Bill 71.
Honourable members, before the Assembly is second reading of Bill 71, Employment Standards COVID-19 Vacation Leave Amendment Act 2021. Is there anyone else wishing to join in the debate this evening? The Honourable Official Opposition House Leader.
Thank you very much, Mr. Speaker. And it is just a great pleasure to be able to join in the debate on Bill 71, the COVID-19 Vaccination Leave Amendment Act. Because with first reading having just passed, this leave has now come into existence in our province. And it is now in effect and something that workers will be able to rely on and something that will help our province in our fight against COVID-19 and in our efforts to make sure that we get everybody vaccinated. And truly, Mr. Speaker, it's fantastic because just yesterday I was standing with our leader and making the offer to the Premier and to the government to work with them to provide 3 hours of paid leave to all Albertans and to make sure that any necessary legislation would get passed quickly. And I'm pleased to join in that work this evening. Right away, the conversation started, and I want to say thank you to the Minister and to all the public servants who I imagine have been working furiously to get this leave put together and this bill that we are now able to debate on the floor of the Assembly. We know that this bill is similar to the bills in BC and Saskatchewan, and it will provide all working Albertans 3 hours of paid leave to get their vaccinations. And it's going to benefit our province as well as employers and employees. We know nobody wants to right now find out that they can qualify. For example, people 40 and over can qualify for AstraZeneca, and then log on to book an appointment and realize that they're going to have to wait a very long time before they're able to get to that appointment, or maybe see that only available spots are available when they need to be at work. No Albertan should have to choose between working and putting food on the table versus their own health, versus getting that vaccine. And this bill means they don't have to choose, and I'm very proud to be standing here with the caucus to help make it a reality. In February, we did call on the government to speed up the province's economic recovery and ensure workers could get vaccinated without fear of losing parts of their income. We said at that point, every day of hesitation hurts our provincial economy, and the government should be aggressively tearing down any barrier that might delay an Albertan from getting their shots. And I'm very happy that today we are here supporting Albertans. There's so many good things in this legislation, Mr. Speaker, and as it was just introduced, I'll just very quickly give a quick summary for those watching at home. The legislation uses plain language. This will be easy for employers and employees to understand. Like in BC, there's no requirement for medical notes or to disclose to employers why the leave is being requested. It protects private information about underlying conditions people may have. The legislation is set to provide the same benefits to all Albertans, no matter what type of job they might have. And like both Saskatchewan and BC, workers cannot be terminated for going to get a vaccination. Like BC, this legislation is going to cover both first and second doses, and it has flexibility, allowing up to 3 hours paid leave or more if circumstances warrant. And finally, the bill has no requirement on minimum time employed, meaning it's available to all employees. So this is all really, really great. And it's a good thing for business as well, because the sooner that all of our employees, all of the workers in Alberta are vaccinated, the sooner we can move back towards normal, the sooner we can start to see improvement in our economy. Kids won't need to be worrying about online school. Sports fields can open up. We can go and enjoy beer in a pub. Until then, we will continue to encourage all public health orders be followed and ask all Albertans to go and get vaccinated as soon as they can. And today's COVID-19 leave is going to help that. I do hope that the government, as the bill passes, will continue to monitor and be responsive if any issues come up around family-related leaves. But certainly this bill is reflective of the kind of responsiveness that all workers in Alberta hope for from their government in this House, whether they work at a grocery store, a hospital, Cargill, or spend the day driving for Uber or a taxi service. I'm very happy to support this legislation. Very glad that the government heard our offer, considered it, took us up on it, and passed this so quickly to help workers in this province. Thank you, Mr. Speaker.
Honourable members, are there others wishing to join in the debate on Bill 71 at second reading? Seeing none, I am prepared to ask the Minister to close debate. The Honourable Minister to close debate, should he choose to do so.
Well, thank you, Mr. Speaker, and thank you to the honourable member across the aisle for her comments. Again, this bill is about supporting Alberta workers. Alberta workers have worked very hard throughout the pandemic the past 13 months. Those who continue to show up providing frontline services, and also those who worked from home, who made different choices, but still kept reducing the spread while continuing to do work and drive the economy forward. We believe that the COVID leave, paid COVID leave, will help reduce barriers for a certain group of employees who will can have some very difficult time in terms of finding the time to get the shot and missing work and can't afford to do so. We urge, again, all employees and employers to work together, continue to work together as they have done throughout the pandemic to minimize the impacts on employees, which this new legislation will do, but also minimize the impact on employers, because employers also are facing challenging times to keep the cost to be reasonable to work together. And that is why this legislation talks about up to 3 hours, so that the conversations could be had between employees and employers about getting that shot, making sure they get it, because what at the end of the day, which is of critical importance, is we get Albertans vaccinated, Mr. Speaker. That is the path forward out of the pandemic, and the sooner that we can get that done, we can open up our economy, and then our economy can start driving. People will get back to work, and Mr. Speaker, that's what our government is focused on: lives and a livelihood. So I ask the entire chamber to support this in second reading. Thank you, Mr. Speaker.
Honourable members, the Honourable Minister of Labour and Immigration has moved second reading of Bill 71. All those in favour of the motion for second reading, please say aye. Aye. Any opposed, please say no. In my opinion, the ayes have it. That motion is carried and so ordered.
Bill 71, Employment Standards COVID-19 Vaccination Leave Amendment Act 2021 is now read a second time.
Committee of the Whole.
Okay, I would like to call the committee to order. The Committee of the Whole has under consideration Bill 71, Employment Standards COVID-19 Vaccination Leave Amendment Act 2021. Are there any comments, questions, or amendments to be offered at this time? I see the honourable member for Stony Plain Spruce Grove has risen.
Yes, thank you, Mr. Speaker, and it's an absolute pleasure to rise tonight for Bill 71. To start off, what a year this past year has been. As 2020 began, we never could have imagined all that lay before us with COVID-19. We adapted countless words and phrases into our everyday vocabulary. Unprecedented times, stop the spread, social distancing, global pandemic. We adapted new ways to communicate with virtual meetings such as Google Meets, Zoom, and Microsoft Teams. For some of us, we found out about the challenges of teaching our children online, dealing with quarantines of family members and friends, and experiencing shortages of patients, and of course, who could forget the lack of toilet paper last year. Mr. Speaker, 2020 was a year that we will not forget. However, on a somber note, livelihoods were impacted. Lives of loved ones were lost. Some businesses closed, and some temporarily, and unfortunately, some for good. Albertans adapted to different ways of doing things. Our students learned from home. There were restrictions on how many people could be in a business at a time. Even restrictions on how many guests we could all have in our homes were only a few of the sacrifices that were made by Albertans, and we thank each and every one of you for everything that Albertans have done. Albertans are hardworking and resilient, and together we are getting through this. Mr. Speaker, after a long road, vaccinations are now our light at the end of the tunnel, and they are the key to our province's recovery. We want to encourage every Albertan who can to get the vaccine. Our government has observed our neighbor provinces to the left and to the right, and we are putting this leave in place through legislation as a clear-cut way that we're able to support Albertans as we come through this pandemic. I am proud to see our government take action today with Bill 71 to reduce the barriers that may stand in the way for any one of us that may struggle either financially or with time to receive the vaccine. With this bill, whether full-time or part-time, all eligible Albertans will be able to take up to 3 hours of job-protected paid leave per dose of the COVID-19 vaccine, retroactive to the day of this bill's first reading, which I can now confirm is today, of April 21st. Albertans who choose to take advantage of this leave will not have to fear reprisal, penalty, or worry about how they're going to put food on their tables in order to do their part in the fight against COVID-19. I have heard from constituent after constituent throughout Spruce Grove and Stony Plain on the challenging year that this has been for them and their families. By getting as much of our population vaccinated as possible, we can move closer to reopening our economy. Mr. Speaker, in closing, I plan to get the vaccine myself, and I encourage my constituents in Spruce Grove and Stony Plain and all eligible Albertans to do the same when their time comes. Today is another example of our government's ability to take swift, bold action to make a difference in the lives of Albertans. And I want to thank my colleague, Minister of Immigration and Labour, for the incredible work that he has put into this bill and for the real difference it will make in the lives of everyday Albertans. Thank you.
Thank you, Honourable Member. Are there any other members looking to join debate? I see the Honourable Member for Edmonton Decore has risen.
Well, thank you, Mr. Chair. It is quite a pleasure to be able to rise this evening to speak to Bill 71, something I'm very firmly in favor of today. You know, the struggles that I think that workers face each and every day, putting food on the table, trying to pay for their bills, making sure their kids get to school, kids get to daycare, things like that, can be a lot of stress for a parent these days. Now, of course, that we find ourselves still in the midst of a pandemic on the third wave, those challenges are increased even more. And so when there's opportunities to reduce barriers for them, that's always a good thing. And the reality is there's workers here right in our own province of Alberta that each and every day sometimes are faced with the decision of, do I go to work or do I take time off to do whatever the case may be? And a lot of times that decision is, well, I have to go to work, and other things suffer. Bill 71 will remove that barrier to being able to get vaccinated. So I'm very, very pleased to see that the bill has flexibility for up to 3 hours of paid leave. That completely takes out that decision that some of those employees will face around getting vaccinated. They won't have to worry about not receiving a full paycheck for that week, so that they can then turn around and go and spend that money in all the local businesses as they normally would do. I'm also very pleased to see that there's no minimum time required to be employed at the employer. So anybody who's been there for 25 years to anyone that's been there for 25 minutes will be able to go and get their vaccination, because that 3-hour time period also, includes things like travel. And for those that maybe don't have a vehicle, they rely on public transit. That means a bus ride to get there to their appointment, then a bus ride back in order to get back to their employer. And so I also noticed that there is a provision there that should there be some kind of challenges, maybe because of distance, the reality is we have some folks that, say for instance, live out in Spruce Grove, work in Edmonton. This will allow them potentially even the travel time there. If they get stuck in traffic, things like that happen. So as I've always said, I always give kudos where it's due, and the Minister of Labour and Immigration has done some very, very good work here with Bill 71. I'm very pleased to see this here, and I'm very happy to support it wholeheartedly, so that not only can we get Albertans vaccinated so that they can start getting about their daily lives, but then they can start participating in the economy in a fulsome way like they used to before, which also uplifts all of our hardworking, small business owners, medium business owners, and even the large ones, so that Alberta can once again, try to lead the way and show, the economic powerhouse that it can be. So my support is behind you on this, Minister. I urge every other member of this House to support Bill 71 here in Committee of the Whole.
Thank you, Honourable Member. Are there any other members wishing to join debate in Committee of the Whole on 71? Seeing none, I am prepared to ask the question. I see the Honourable Minister. If nobody is willing or willing to stand up, I will call the question. So are you ready for the question on Bill 71, Employment Standards COVID-19 Vaccination Leave Amendment Act 2021? On the clauses of the bill, are you agreed? All those in favor say aye. Any opposed say no. That is carried. On the title and the preamble, are you agreed? Any opposed? Carried. Shall the bill be reported? Are you agreed? Any opposed? Carried. Sorry. Yes. I see the Honourable Minister of Justice and Solicitor General.
Thank you, Mr. Chair. I move that the committee rise and report Bill 71.
Heard the motion as proposed by the Honourable Minister. All those in favour, please say aye. Aye. Any opposed, please say no. That is carried.
Can see me in like 5 minutes. The Honourable Member for Brooks, Medicine Hat.
Mr. Speaker, the Committee of the Whole has had under consideration certain bills. The committee reports the following bill, Bill 71.
Honourable Members, does the Assembly agree in the report? If so, please say aye. Aye. Any opposed, please say no. My opinion, the ayes have it. That motion is carried and so ordered. The Honourable Minister of Labour and Immigration.
Thank you, Mr. Speaker. I rise to seek unanimous consent to waive Section 77, subsection 1, to proceed to third reading of Bill 71.
Honourable Members, the Minister of Labour and Immigration has requested unanimous consent to proceed immediately to third reading of Bill 71. I will ask only one question. Is there anyone opposed to providing unanimous consent? If so, please indicate so now. Hearing none, unanimous consent is granted. The table.
Under Government Bills and Orders for third reading, Bill 71, Employment Standards COVID-19 Vaccination Leave Amendment Act 2021, Honourable Mr. Copping.
The Honourable Minister of Labour and Immigration to move third reading, and if the Assembly is fast enough, you might be able to do this in under half an hour.
Thank you, Mr. Speaker. I am pleased to rise to move third reading of Bill 71, COVID vaccine leave. Mr. Speaker, since March 2020, this government has been responding to the COVID pandemic with swift action. And today is another example of how we move quickly to protect Albertans' lives and livelihoods. And I would also like to thank members opposite in terms of assisting us in doing this in a very quick manner and perhaps under 30 minutes, as you indicated, Mr. Speaker. Mr. Speaker, if the legislation passes today, Albertans will be able to get their COVID-19 vaccine as soon as possible without fear of losing their job or losing pay. Mr. Speaker, we know that COVID-19 moves quickly, so we must also move quickly to provide Albertans with the support that they need so they can protect themselves, their communities, and fellow Albertans. Mr. Speaker, Albertans are eager to get their vaccines, but some may feel they can't afford to take the time off work to get immunized. Offering Albertans up to 3 hours of paid leave for each vaccine dose will help them make the choice so they can protect themselves and their families and still pay their bills. Mr. Speaker, the sooner Albertans get vaccinated, the sooner we can bend down the curve of COVID-19 cases and begin reopening our economy. And if passed, this act will take effect on the day the bill receives first reading, and Mr. Speaker, that day is today. Having the leave take effect on this date makes sense because it aligns with the time that the vaccine became available to people aged 40 to 55 who are likely to be working, Mr. Speaker. All employees, regardless of how long they have worked for their employer, are eligible for this leave to make sure it is easy as possible for Albertans to get vaccinated. This includes full-time and part-time employees. So as our vacation program ramps up, Mr. Speaker, the end of the pandemic gets nearer and nearer. And we are all looking forward to a time when enough Albertans are immunized so that we can reopen more businesses, go to events, see our friends, a family, and get Albertans back to work. Today, we are taking an important step in that direction by offering paid vaccination leave to Albertans. Mr. Speaker, thank you very much for the opportunity to move third reading of Bill 71, COVID vaccine leave.
Honourable members, are there others wishing to speak to third reading? The Honourable Official Opposition House Leader.
Thank you very much, Mr. Speaker. And I rise at third reading simply to say that it's just such a pleasure to be part of something so positive right now, given what the province has been going through with COVID-19. Being able to tell workers that they now have up to 3 hours of paid leave to be able to get their vaccination is going to remove a barrier, is going to remove a source of stress. And as I stand here, I think about who this is going to help. Our frontline essential workers who have been most impacted by the pandemic, who are often lower wage employees, sometimes working multiple part-time jobs, where the financial potential impact could have harmful consequences to them. Removing that barrier and assuring that they can take a paid leave is a really, really positive thing. And I'm so pleased to be part of third reading here in the legislature this evening. We will continue in the official opposition to put forward great ideas. And the government has seen this as a great idea and we've enacted it. I want to assure the government we have lots of other great ideas. And we will continue to put those forward. And it's excellent to be able to see this type of cooperation in order to bring something that truly will make a big impact in the lives of Albertans. And to conclude my remarks at third reading, Mr. Speaker, I'd just like to say that vaccines are safe and effective, and vaccines save lives. And I encourage all Albertans, when you qualify and are able, please go and get vaccinated. It's going to make a huge impact to our recovery in COVID-19, to protect our friends and neighbors, and to get back to the Alberta where we can hug each other again, which I'm looking forward to, Mr. Speaker. So thank you very much for allowing me to rise and speak to third reading of this important bill.
Well, members, it would seem that teamwork does make the dream work. Are there others looking to join in the debate? Seeing none, I am prepared to call upon the Minister to close debate if he chooses. The Honourable Minister of Labour and Immigration to close debate.
Mr. Speaker, I would like to close debate. Once again, thanks the official opposition for working with this and getting this important member to support Alberta workers and Albertan business and our whole economy doing this. And once again, I would echo the comments that for those who can get vaccinated, please do so. When you have the opportunity. I'm looking forward to my vaccination, which I booked for next week, because we need to not only protect ourselves, but protect others, get through the pandemic, and get Albertans back to work. And with that, I move closed debate.
Honourable members, the Minister of Labour and Immigration has moved third reading of Bill 71, Employment Standards COVID-19 Vacation Leave Amendment Act 2021. All those in favor of the motion for third reading, please say aye. Aye. Any opposed, please say no. In my opinion, the ayes have it. That motion is carried and so ordered.
Bill 71, Employment Standards COVID-19 Vaccination Leave Amendment Act 2021 is now read a third time.
Under Government Bills and Orders for second reading, Bill 65, Health Statutes Amendment Act 2021, adjourned debate on amendment. Ms. Hoffman.
Well, honorable members, such great progress already this evening. Perhaps we can keep a good thing rolling, right, for the rest of the evening. Honorable members, Bill 65, we are on amendment REF1, and I see the honorable member for Edmonton Goldbar has risen.
Thank you, Mr. Speaker. And to answer your question, no. That's the end of the good times rolling. As we get back to the regularly scheduled government agenda, it's disappointing. I am encouraged to see that it only took a half an hour for the legislature of Alberta to make a meaningful, positive change in the lives of hundreds of thousands of working Albertans. It's incredibly disappointing and frustrating to me and most of my constituents to consider that it's taken 71 bills to get to this point of seeing meaningful, positive change for the people of Alberta during the pandemic. And certainly Bill 65, which is now before us for consideration, does nothing to take care of the pandemic, and in fact raises a bunch of questions that I think are worthy of additional consideration by members of this chamber. And that's why I'm rising to speak in favor of the amendment that was made by my friend from Edmonton, Glenora, to refer this bill to committee for further consideration. And in fact, there are a number of points that I think need to be considered by the committee when, if this bill is referred to committee. Of course, this bill continues the government's tradition of omnibus legislation that makes changes to a number of pieces of legislation at one time. And of course, that's been part of the government's strategy, is to keep the pace of change so overwhelming that Albertans can't possibly keep up. And you only have to look at the poll numbers and the public's response to a lot of the things that have gone on in this House to see that political strategy has not been very successful. And I think the government would be wise to consider slowing down the speed of change that it's taken to a number of important pieces of legislation and public policy, and that includes Bill 65 here. I think this would be an excellent opportunity for government members to recognize that the speed with which they've legislated a number of sweeping changes that have been incredibly unpopular have really angered the people of Alberta. And I think that by voting to refer this bill to committee, the government could send a signal to the people of Alberta that they've listened to them and that they've realized the error of their ways in changing things so quickly, and sending them a signal that they've decided to maybe take a different approach and give pieces of legislation like Bill 65 the consideration, the due consideration that it's the consideration that it warrants. Now, when a couple of examples of issues that are raised in this piece of legislation include some of the information related to the changes made with respect to response response to a fatality inquiry by Judge Dixon. And in her comments on this piece of legislation or in her comments on this referral when she first made it, my friend from Edmonton, Glenora, mentioned that there was a fatality inquiry conducted by Judge Dixon into the tragic story of Miss Lewis, who suffered from homelessness and a number of mental health issues. She was admitted to the hospital under the Mental Health Act, and through a series of tragic events, and because of policy and legislation that enabled them, Miss Lewis ultimately died in the emergency room. And in his fatality inquiry, Judge Dixon made a number of recommendations for changes to various pieces of legislation. And in her comments with respect to those changes, my friend from Edmonton, Glenora, noted that only one of the recommendations that Judge Dixon made appears in this piece of legislation. And I think it would serve the people of Alberta well if we were to refer this bill to committee and give members of this legislature the opportunity to dig into the changes that have been made in response to Judge Dixon's fatality inquiry, and understand why the minister has only decided to adopt one of those recommendations and not the rest of them. You know, it is an unfortunate aspect of this legislature that we don't have the opportunity to question department officials during debate on pieces of legislation. But we can give our members the opportunity to do just that by sending this bill to committee. Because I know that I certainly would be interested in hearing from officials in the Ministry of Health to understand their perspective on Judge Dixon's fatality inquiry and the recommendations that he made. And understand what the Department of Health's position is on those recommendations and why they don't show up here. I think all of the people of Alberta would be served by having that discussion in public. And so I hope that that by voting in favor of this referral amendment, that members do affirm their support for having these kinds of discussion in public, because these are some very serious issues that are confronting the province of Alberta, and we need to take the appropriate amount of time and consideration to look at them. Now, I mentioned that it would be worthwhile for us to call Department of Health officials to committee to discuss changes and the lack of changes that sprung from the Dixon fatality inquiry. But there are a number of changes in here with respect to auto insurance and a number of penalties that could be assessed by the minister with respect to auto insurance companies that don't file their reports on time. Now, certainly when this bill was introduced, it appeared to my friend from Edmonton Centre that this seemed to be a covert way for the Minister of Finance and his colleagues on Executive Council to give yet another financial gift to the auto insurance industry. Now, we understand that the filing of these annual reports by insurance companies has implications for the Ministry of Health and how the industry sets its insurance rates and those kinds of things. But I think it would be interesting for members of this Assembly to be able to bring Ministry of Finance and Treasury Board officials to committee, to question them on why they found that these changes were necessary. Because certainly we've heard nothing that would approach a satisfactory explanation from the Minister of Finance or any of his colleagues on Executive Council as to why these changes are necessary. And it's incredibly distressing to me, Mr. Speaker, the lengths to which the government has given away the store to automobile insurance companies. Just last fall, we dealt with legislation that made significant changes to the automobile insurance regulatory framework in this province that were a significant financial benefit to the automobile industry. An industry that I don't need to remind people made over $1 billion in profits last year. It's far from an industry that needs government handouts and government financial support. But that's what this government seems to be doing. And so I think that by voting in favor of this referral amendment, we can invite ministry officials from Treasury Board and Finance to come to committee and explain to us their rationale for making these changes, and take questions from members of the legislature about the impact of these changes as well as the cumulative impact of all of the changes that have been made to the automobile insurance regulatory framework in this province, so that we can clearly understand what is going on with the automobile insurance industry and understand why the government seems to be so keen to give away these gifts at every possible opportunity. Now, I understand that members of this House are not keen to embrace the openness and transparency that committees provide, which is an interesting change in tone and position from that which was held by the UCP and its forerunners in the 2015 to 2019 legislature. Certainly, it seemed that every bill that we introduced, they were keen to send to committee, and they were keen to invite departmental officials to come and talk to members of the legislature about the impacts and the thinking, the impacts of the changes and the thinking behind them. And yet, when they found themselves in government, Mr. Speaker, members want nothing to do with committees, and they certainly don't want ministry officials to appear before committee. And I have countless examples of government MLAs working to make sure that ministry officials don't appear before committee. We recall in February, we convened a meeting of public accounts to send an invitation to the Ministry of Energy to talk about the impacts of rescinding the 1976 coal policy. Well, before we could even get the meeting started, Mr. Speaker, the member from Livingston-McLeod introduced a motion to adjourn. And so 10 minutes after the meeting was convened, the meeting ended, so that we didn't have to look at, or so that the government members allowed the Ministry of Energy to get off the hook. This is a disturbing pattern that's been demonstrated by government members on the Public Accounts Committee. Earlier in the year, we brought forward several motions to bring a number of ministries to public accounts so that we could question them on their annual reports. And again, the government members voted to make sure that those ministries that spend the most money have a significant number of policy initiatives and spending programs underway that have significant impacts to the people of Alberta, that they don't have to come and answer questions. And instead, we look at ministries that get a relatively clean bill of health from the Office of the Auditor General and have not a lot controversial going on. All of this has been incredibly unpopular with the people of Alberta. They understand that the government members are working overtime to try to cover up what's going on in so many departments of the government. And my message to the members in the government caucus is that this is clearly an approach that is not working. I'm sure that they hear it from their constituents all the time. I hear it from their constituents all the time. I get emails from their constituents because they don't get an answer from their UCP MLAs when they write or phone them, and so they call me. So in an effort to change their approach and win back public support, I urge all members of this House to vote in favor of this referral.
Honourable members, Standing Order 29-2A is available if anyone has a brief question or comment for the member for Edmonton Gold Bar. It looks like the honourable member for Edmonton Highlands Norwood has a brief question or comment.
Thank you, Mr. Speaker, and thank you to my colleague from Edmonton Gold Bar for his comments on Bill 65, the Health Statutes Amendment Act. And, he did a pretty thorough analysis of some of his specific concerns about this bill. But, we are, of course, in second reading, and that gives us some latitude in connecting this bill to some of the bigger issues. And so he sort of alluded to it in his closing remarks about how he's hearing from not just his own constituents, but from constituents of government MLAs as well. And I wondered, I know he hears from a lot of folks in his riding about just, healthcare in general, about the incessant fighting with doctors, about the, attacks on rural healthcare, the firing of healthcare workers, the looming privatization of healthcare, the list goes on. So I just wondered if the member might share a bit more about just, broadly what he's hearing about healthcare, and whether or not he's also hearing from constituents from other ridings as well.
I'm sure the honourable member for Edmonton Highlands Norwood means broadly what you're hearing about healthcare as it relates to the bill. I'm sure was the question. The honourable member for Edmonton Gold Bar.
Thank you for that clarification, Mr. Speaker, and I want to thank my friend from Edmonton Highlands Norwood for her thoughtful questions. And if I may, Mr. Speaker, I will say that the member from Edmonton Highlands Norwood always has thoughtful questions in this House, whether it's in question period or during debate on matters of important public policy. The member from Edmonton Highlands Norwood stands well above many of her colleagues here in this House in terms of making thoughtful contributions to the debate. And I would urge all members to emulate the model that she sets for us, because she does such an outstanding job as a representative for her constituents. With respect to healthcare, Mr. Speaker, and how it relates to this bill and what I'm hearing from my constituents as well as from other Albertans around the province, I do hear a lot of grave concern about the state of our healthcare system. The member from Edmonton Highlands Norwood mentioned concerns around adequate numbers of physicians and adequate numbers of other healthcare workers who face potential layoffs after the government has deemed the pandemic to be over and sees fit to fire up to 11,000 people who are working in the public healthcare system. What I'm hearing from my constituents is grave concern that their healthcare needs will go unmet. I've heard from a number of constituents who are either suffering from cancer in particular, Mr. Speaker, or have loved ones who are suffering from cancer, who have had surgeries repeatedly deferred because the pandemic has overwhelmed our healthcare system, and there is no additional capacity right now to treat these other potentially fatal illnesses that my constituents are suffering. And certainly, these concerns are warranted. We certainly see that Statistics Canada has verified that more people are dying unnecessarily because our healthcare system is overwhelmed. In 2020, they calculated a high number of excess deaths. And so it's, when I hear from constituents who are concerned that they or their loved ones will not be able to get the life-saving surgeries and other healthcare treatments that they need, that's incredibly concerning to me. And it's doubly concerning to me when I walk into this legislature and I hear from the Minister of Health and the Minister of Finance and the Premier about how much additional money they seem to be spending on healthcare in the budget. Because that statement does not match up with the reality on the ground. Those additional dollars.
Honourable members, are there others wishing to join in the debate this evening? The Honourable Member for Edmonton Whitemud on Amendment REF1.
Thank you, Mr. Speaker. It's a pleasure to rise and speak in second reading to Bill 65, the Health Statutes Amendment Act, Spring 2021, and of course specifically to speak to the referral amendment brought forward by my colleague. I want to thank the member from Edmonton Gold Bar for providing some thoughtful comments, not only on the esteemed qualifications of our colleague, the member from Edmonton Highlands Norwood, but actually also on the content of the bill, because this is, I think, the third time that we've seen a Health Statutes Amendment Act since this legislature was formed and began just 2 years ago, since I've been an elected member of this assembly. And it's, it sort of seems sometimes, Mr. Speaker, that there seems to be some kind of, race going on by this government to try to just create pieces of legislation over and over again and amend the same act several times and bring forward multiple omnibus pieces of legislation that often amend the same pieces of legislation over and over again. And I know I've seen at the end of some of our legislative sessions that there seems to be such great pride in the amount of paper that this government produces in terms of legislation, as if that's some sort of measure of the quality of the governance that's taking place right now. I do wish, as we are in the middle of a epic pandemic in this province, and we are in the middle of an economic crisis right now, that the amount of paper the government is producing was less of a measure of their quality and productivity, and rather there was more of a focus on ensuring that Albertans are safe and healthy and that our economy gets back on track by making thoughtful consideration on those issues, of which there are multiple. But yet we still seem to spend a great deal of time in this assembly looking at more and more pieces of omnibus legislation, and once again, that appears to be what Bill 65 is, Mr. Speaker. Now, with respect to the question of the referral to a committee, there are a number of pieces that my colleague has already indicated that have raised some questions, and of which to date I believe this assembly has not yet gotten fulsome responses, which suggests that perhaps the opportunity to hear from some stakeholders and some organizations that may be affected by some of the changes that are set out in Bill 65 would benefit from. And in fact, this assembly, so we can be thoughtful. If the government believes these changes are significant enough to be bringing forward in the middle of both a health and an economic crisis in this province, obviously they must have significant impact on a number of organizations and therefore merit some thoughtful consideration, which is why I support this amendment that this bill be referred to committee for further consideration. So I want to go through my sense, Mr. Speaker, if I may, about some of the provisions that are changed within this bill and where there are some things which seem to be minor and which I don't think seem to warrant much consideration because they do just seem to be housekeeping matters. So I want to highlight that Bill 65 does amend a number of pieces of legislation. I think by my count, 6 pieces of legislation are amended by this bill, two of which I have to say seem to be quite minor. There are amendments to the Mental Health Amendment Act, which are minor housekeeping amendments, simply to correct some section references. Again, I believe that was an act that was already before this House at some point. And as well to delete some unproclaimed sections. Again, not sure why this was not considered the previous time this bill was put forward by this government for consideration. And there's also changes, minor changes to the Health Facilities Amendment Act. Again, minor housekeeping changes. But again, this is not the first time that we have seen that piece of legislation being amended. I just question those two pieces of legislation likely could have been dealt with, considering by the government's own account that those changes are housekeeping, likely could have been addressed by Miscellaneous Statutes Amendment Act, which I'm certain we will also be seeing shortly in this House. If it has not yet been introduced this session, I'm sure we will be seeing that. And so that takes me to the other four pieces of legislation that Bill 65 amends or seeks to amend. And there are some questions that arise from that. Now, I thank the member from Edmonton-Goldbar and my colleague, the member from Edmonton-Glenora, for providing a little bit of context with respect to some of the changes that are proposed in the Alberta Evidence to the Alberta Evidence Amendment Act. So, from what I understand, Bill 65 would amend that act to allow for fatality inquiries, which are, quasi-judicial. Well, they are investigations into a fatality that has taken place under the circumstances for the purpose of providing recommendations to government and other public bodies with respect to how to change policies, procedures, conducts, so that the circumstances that led to the death that was the subject of the fatality inquiry simply do not happen again. And I've spent a bit of time immersed in certain fatality inquiries, which are usually quite tragic because the circumstances that lead to them are of course, because somebody has died, but because there's a sense that what happened should not have happened and could have been prevented. And it's not because there's criminal conduct that is involved. That is a separate determination, of course, but simply that there are lessons to be learned from those fatality inquiries. And so certainly when this Assembly was considering, for example, Bill 39 last session, which dealt with the death of a child in an unlicensed care setting, it is quite tragic whenever one's looking through a fatality inquiry. But it is important to take those recommendations seriously. And I understand that the changes that are being proposed here in Bill 65 to the Alberta Evidence Amendment Act are a result of a fatality inquiry. I believe the recommendations were made back in 2016, and they relate to the death of a woman named Sharon Lewis. And from what I can understand, and I appreciate that it appears to be a number of recommendations within this fatality inquiry, and there are some questions I believe that were raised by the member from Edmonton-Glenora as to whether all of the recommendations that were put forward in that inquiry report have been considered and implemented. By my brief sort of review of that inquiry recommendations, it appears that many of those recommendations were directly to the hospital involved and where Ms. Lewis passed away. And but certainly one of those recommendations was specifically to the Alberta Evidence Act to make sure that when fatality inquiries are doing their work and considering the documents and records before them, that they have access to a full set of documents. And so in this case in particular, the hospital in question had done some quality assurance processes, and for reasons that I'm not entirely clear about, the records from those quality assurance processes were not actually available to the fatality inquiry. So the purpose of this amendment is simply to make sure that when a fatality inquiry is being conducted, that health system quality assurances committees can have access, or the facts from those assurance committees can be part of the fatality inquiry, and therefore the review would be more comprehensive. That I don't seem to have a concern with, Mr. Speaker. However, there are questions about, I am concerned, just as my colleague, the member from Edmonton-Goldbar raised, about changes to the Crown's Right of Recovery Amendment Act changes that are part of Bill 65. In particular, while I believe the government news release tried to sort of characterize this as a intention to simply reduce red tape, what it does do is it actually seems to allow the minister to waive penalties that may be imposed upon auto insurance companies who failed to provide the appropriate information about the premiums that have been paid, because a portion of premiums that are paid to insurance companies actually goes to the government. So that reporting mechanism is important so government ensures that they get the right amount, and penalties can be imposed on auto insurance companies if they fail to provide the proper records. Now, that would make sense. I mean, obviously it's about accountability for dollars and public dollars, something we should all be interested in. So it's quite surprising that this government believes that that accountability is not necessary, that those penalties which can be imposed on auto insurance companies, who I believe, if I'm correct, have had some very profitable years in the last few years, especially since the current government has lifted the cap on auto insurance, which our government put in place, which was keeping insurance manageable and affordable for Albertans. One would think that we would want to continue to keep that as affordable for Albertans. One would think that a government would want to ensure that. But that cap was lifted, and of course, we know that many Albertans are paying skyrocketing auto insurance rates as a result. This is not the first time we've seen in this session alone legislation being brought forward that would primarily solely financially benefit auto insurance companies. And that appears to be what this is about too. It's giving Minister the ability to waive these penalties for auto insurance companies who fail to properly account for dollars that should be going to support the services and goods that the government of Alberta provide. I don't know why this government does not seem to think accountability for public funds is an important thing. This is just a small example. It's probably why it's snuck into this omnibus bill the way it is. But this is just one more example about how the government does not believe that certainly profitable corporations should be held accountable for public dollars. And I believe the minister has even asked us to, what are the parameters around which the minister would have the discretion to waive these penalties to auto insurance companies. And while, of course, when asked, I believe the minister said, they'd be waived only in extraordinary circumstances. However, that's not what the bill says. And we constantly see in this assembly, Mr. Speaker, this dissonance between what is actually in the legislation that's brought forward by this government and what they say they're going to do with it, as if they can rely simply on saying, trust us, to the Alberta public. And as I've said many times, and I'm sure I will say many times again, Mr. Speaker, trust is not something that many Albertans have in this government anymore. So when they say the minister will only waive these penalties for profitable car insurance companies, auto insurance companies, in extraordinary circumstances, well, they better put that in the legislation if they want Albertans to believe what they're saying. But that's not what's in Bill 65. So I think a referral to the committee is important so that that matter can be considered. We can find out exactly what parameters should be in place to ensure what are the circumstances under which waiving those penalties would be necessary, and does this bill reflect that intent? Because right now it doesn't seem to. On one more note, Mr. Speaker, I'd like to say there's a change with respect to the ability of pharmacists, and these are changes to the Health Professions Amendment Act, and it enables pharmacists and pharmacy technicians to continue offering professional pharmacy services supporting animal health, and particularly it allows pharmacists essentially to provide services to pets and herd animals. So do that kind of work, which I don't believe until now pharmacists were able to do. I understand that this is meant to align with changes that were made to the Food and Drug Act by the federal government. We have seen some statements, I believe, in the media from I'm going to get the name of the organization appropriately here, the Alberta College of Pharmacies, about their support for this. But just a question which I think, again, lends itself as to why this should be referred to committee. I haven't heard any discussion about whether or not, for example, the Alberta Veterinary Medical Association supports this, that pharmacists will now be able to provide treatment to animals, to herd animals and pets. And whether or not they have been consulted. And I think that would be an appropriate thing for the committee to consider if this matter is referred, as I suggest that it should be. The last thing I have to say, Mr. Speaker, is I'm going to go back to a comment that I made at the beginning, which is that it's really hard to understand, and I'm sure there's probably some Albertans out there who, if they're watching these proceedings right now, hopefully they were, to see this epic cooperation that just took place between the government and the opposition to pass Bill 71 in epic time. And I'm very glad to see that cooperation and to see that kind of progress on something that is going to be so important for Albertans. And maybe some of them are still watching and they're wondering, you know, we are in critical economic and health circumstances in this province right now. The third wave is in full force right now. Tens of thousands, hundreds of thousands of Alberta students are online right now. I know many students in my riding who are students of Edmonton Public and Edmonton Catholic will be going online tomorrow. We know so many businesses are struggling right now, and we are certainly concerned about our economic recovery. So why are we talking about pharmacists being able to provide services to herd animals and pets? I'm not saying these are not significant issues for those pharmacists. For sure it is. But right now, I'm sure many pharmacists are pretty concerned about delivering vaccines as fast as they can. And managing the wait lists. I know I got my vaccine today, Mr. Speaker, and I was very pleased to do that and thrilled to do that. My kids were very excited. They think it gives me superpowers, and I feel kind of, Mr. Speaker, like it does. But pharmacists right now, the pharmacy I went to, they had 1,000 people on a wait list to get a vaccine. It just seems to me, Mr. Speaker, sometimes that we talk in this House as if what's happening outside these walls isn't happening. And it is. And we need to be meeting the moment that Albertans expect us to, and bringing forward this kind of omnibus legislation that does not seem to meet the needs of most Albertans right now, the most pressing concerns on their mind about the healthcare system and their economy and their jobs and paying for things like their child care. I mean, these are the issues that are facing Albertans. And it does not seem to be, if we look at the grand scope of this legislative agenda from this government right now, that this government is meeting that moment.
Honourable members, Standing Order 29-2A is available. If anyone has a brief question or comment, the Honourable Member for Edmonton Decor.
Well, thank you, Mr. Speaker. I'm always appreciative of the member from Edmonton Whitemud and the comments and thoughts that she always brings forward to this House, making very, very clear the types of things that, as members of the Legislative Assembly, we have to consider when we're making decisions about legislation. I know there was probably some closing comments that she was looking to add to those. I would be very, very grateful if she'd be willing to continue to share those, because I need to be able to make an informed decision about this bill.
The Honourable Member for Edmonton Whitemud.
Thank you, Mr. Speaker, and thank you to my colleague, the member from Edmonton Decor. As I was saying, Mr. Speaker, I look at this Bill 65, and I simply don't know why a number of these provisions could not have been either addressed, first of all, in previous other omnibus legislation, which once again we were also often dealing with during the pandemic. This is the multiple times we have been addressing the same pieces of legislation over and over again. The example I gave, the detail around the changes to the Alberta Evidence Act, came from recommendations that are already 5 years old. There's no reason these changes couldn't have been made when the Evidence Act was open before. It just simply feels, Mr. Speaker, that the priorities of this government are off track. And to bring forward something, the Health Statutes Amendment Act, and I think there'd probably be many Albertans who would say, okay, let me look at the title of that act, Health Statutes Amendment Act. Well, we are in the middle of a pandemic. Is this going to address, maybe this is a reversal by this government of its fight with doctors. Maybe it's an acknowledgement that we don't need to be laying off 11,000 healthcare workers after the incredible work that they've been doing, and we rely on them every day to do. Maybe this is going to be a bill that's going to address the rural healthcare crisis, the family doctors who are leaving in epic numbers around this province. Maybe this is going to reverse this government's previous decisions around making privatized and healthcare easier. Maybe that's what this bill is about. But instead, when they open up this bill, they'd say, oh, no, of course, none of those things are a priority for this government to address. Instead, they're going to make the changes. They're going to give some cushy deals to the insurance companies yet again, Mr. Speaker, benefits to them. They're going to address and amend legislation that's been opened multiple times before this House. It just doesn't seem to be that this government understands the crisis that we're in and the situation that we're in. Instead, we see these middling kind of changes that either could be put off to another time and let this government focus on its priorities, which should be the healthcare system, which should be the recovery of our economy, and put these, or deal with them in miscellaneous statutes amendments, and let's get them done with. But of course, again, I highlight, Mr. Speaker, that it feels like there's some kind of race to pass as much paper for a government that claims to hate red tape. They sure love to produce pages and pages and pages of legislation that don't make a bit of difference to improve the quality of life for Albertans right now, but do certainly seem to benefit a lot of big corporations. Thank you, Mr. Speaker.
Honourable members, are there others wishing to provide a quick question or comment under Standing Order 29-2A? The honourable member for Edmonton South has approximately a minute and 30 remaining.
Thank you, Mr. Speaker. It's always a pleasure to rise and speak and provide some comments to my honourable colleague from Edmonton Whitemud. I think that it's one of those things where we often talk about, in our caucus at least, that we have our lawyer caucus as a subgroup, and that our lawyer caucus, well, sometimes may provide insight that is difficult for us as non-lawyers to comprehend, certainly is insightful upon deeper inspection. So I think that certainly as we look at this referral, and we look at the very complicated issues that were coming around on Bill 65, and we look at how the changes that are being brought on it really do have these very technical implications, right? And I think they really do have these really difficult conversations that we need to have, which is why my colleague just before me here, and of course so many others tonight, have spoken about the fatality inquiry that was done, and have spoken about the implications of the recommendations of the fatality inquiry. And I think that when we look at these changes, that we see that this legislation simply is insufficient, right? We see this legislation simply does not meet the standard we would normally expect from a government moving on these types of changes, right? That we would normally expect from our government when they are trying to navigate these complex issues, right? So during a pandemic, right now, it is very difficult for us to debate these types of issues, right? It is very difficult.
Honourable members, are there others wishing to join in the debate on REF1? The honourable member for Edmonton Riverview has the call.
Thank you very much, Mr. Speaker, and it's my pleasure to join the debate on Bill 65, the Health Statutes Amendment Act 2021. And as my colleagues have already indicated, it is an omnibus bill. It has 6 pieces of legislation that it aims to amend: Pharmacy and Drug Act, the Health Professions Act, the Alberta Evidence Act, Crown's Right of Recovery Act, the Mental Health Act, and the Health Facilities Act. And certainly, you know, I made the very difficult decision for me to actually become a politician because of a lot of concerns in the health system. And as a social worker for 30 years, I certainly had a front row seat to see where there were gaps in services, where people were falling through those cracks, and where there is substantial work that is needed. And so when I see, okay, they're opening up the Health Act, the Mental Health Act, and they're going to be doing some, you know, positive amendments to that, which we know are sadly needed. And this is very timely because, of course, just this week, I had a very, quite a long conversation with a constituent who told me some of his challenges because he cares, like he's a guardian of his brother who has schizophrenia. And he has lived at Alberta Hospital for 7 years. And he has, you know, a chronic condition that is not going to go away. And he is housed as best he can in that facility. But every 6 months, he, I think several other professionals, nurses, psychiatrists, social workers, must sort of recertify him again. He must always you know, be able to qualify to be in that facility, but it doesn't make sense to have to do it every 6 months. I mean, the enormous cost with all the professionals involved. The Mental Health Act, if that's being opened up, these are the kind of things that need to be dealt with, not some minor amendments. And certainly, you know, this fellow, he shared with me his upset, his angst, and also his fears about Alberta Hospital indeed being closed down and his brother being pushed out into the community, and he knows that his condition is so severe that he just cannot manage. He's afraid he'll become homeless and he'll lose his life on the streets of Edmonton because he won't have the supports he needs. So if we are opening up the Mental Health Act, there are significant things that can be done to improve the services for our province instead of this minor amendment that has been put forward here. So even though this is the Health Statutes Amendment Act, with all this several different kinds of legislation that's being brought forward, it really seems to have missed the mark, Mr. Speaker. That, things that Albertans are deeply concerned about and deeply need support for are not there. And I just want to bring up also other, significant limitations within the services that are available in terms of mental health. Certainly, we know that over 1,100 people died from overdoses last year during the pandemic. That's about 3 people dying every day. And in the first 2 months of this year, 4 people have died a day. So it's actually increasing. And services and supports are needed for people instead of reductions, which we're getting from this government. Like the lack of interest in a harm reduction strategy is one of the key factors in making sure people are kept safe. And we know this government is reticent to work at that model. They want to focus only on recovery, but we know harm reduction saves lives. We know that there's the IOT program, the injectable opiate agonist treatment. They actually closed that program down, and it was set to close at the end of the month, and then a court case was brought forward, and that is only when the government did move to say, okay, we'll reinstate that program, but we're not taking any new clients. So the program is, it's got strict parameters around it. There's other people who need that service, and other people need harm reduction supports, and there's just not that care or interest from this government. And the Health Statutes Amendment Act, on this referral motion, I think sending it to committee would help them more fulsomely understand what really needs to happen with legislation here in our province. Not some minor changes, but actually some fundamental changes so Albertans can have the mental health supports they need. We also know, and this is something that certainly has been in the media quite a bit, but the program for people oftentimes in rural Alberta and people who live sort of in the suburbs of maybe larger centers, they don't have access to safe consumption sites. And we know that the drug supply is unreliable, and even though they are using, they don't want to die. They want to have supports. And so last June, the Associate Minister of Health reached in and stopped a program that was ready to roll out to support people so that they could be safe, they could talk with somebody, they'd know, when they used, and if they didn't respond at a certain time, then emergency services would be sent out to them, effectively saving lives. That program was stopped, and a new one was just announced that's not actually in effect until June, and it's only being piloted in Calgary. So, these are some significant limitations in our sort of mental health programs, in the services that we offer to Albertans, and certainly opening of the Mental Health Act is an opportunity for us to make sure that Albertans are getting the supports, having the proper policies so that they're well taken care of. And I also want to say, just in other aspects of the Health Statutes Amendment Act, that this referral motion going to committee can support the committee members to look at, is that we know, oftentimes people who live on lower incomes, that the usage of our health system is inversely correlated, right? So the lower your income, the higher the usage of the health system. And if we we know that people in the highest income quintile is, they use the health system the least. And so when we know that if people live in good housing, people eat healthy food, fruits and vegetables, people are able to exercise regularly, do all these things that will create health. That is sort of some of the things that we need to have a healthy society. And guess what happens then? The health costs go down. And what I'm really talking about, Mr. Speaker, is the social determinants of health. And this is what this committee and this referral motion should be looking at. They should be looking at how can they create policies, supports in Alberta for people to be able to have that kind of, stable lifestyle where they aren't experiencing these very adverse effects. Sometimes, perhaps chief medical officers of health, for example, experts in health will give tips on, what can we do actually to decrease the costs of health, what can we do to improve it? And this is some examples, but it's not from an individual look, it's from sort of a larger systems look, which we as politicians, that's where we play. We play in the macro environment, and it's up to us to make those overarching policies that actually help Albertans. So for example, these are to do with the social determinants of health. It says, first of all, don't be poor. If you're living in poverty, change your circumstances. Number 2, don't have poor parents. That's not going to be good for your health. And 3, live in a more equal society and support a community. Okay, so this is where government comes in. They can create a healthier society, a society that's more equal, a society that's more fair, and with that, then we have better health outcomes. And we know we're right in the middle of a pandemic, and that certainly has devastated, our regular lives here in Alberta. And if the minister had looked at some of the concerns with mental health and could see what was really important to support Albertans, then this legislation would be much different than what we have before us today. And that's why it really needs to be referred to committee so that they can look at, okay, how can we support Albertans to have better mental health? And certainly as the critic for seniors in housing, I have really deep concerns about how seniors aren't being supported during this pandemic. And we know that the Minister of Seniors and Housing cut about $2 million from grants to support seniors to age in their communities so that they would have those supports and be cared for well. Seniors need transportation support, home maintenance. Sometimes they need that kind of support. They may need housekeeping support. They could also, home care, of course, that's another important health thing, so that people can stay in their communities. And that's where seniors want to be. They want to be aging in their communities. They don't want to move into a larger facility. They'd like to stay where they've lived for many years, where they know their neighbors. And so this kind of supports and legislation is really what the government should be bringing forward. But sadly, that's not what we see before us today. We really see, just very minor adjustments to the Mental Health Act when we're in a significant crisis in mental health with the opioid crisis in Alberta. And I think I've said this many times before, on average, 3 Albertans have died a day from COVID, but but now 4 are dying from opioid overdoses. So that is a significant concern. And certainly we want to make sure that Albertans have the supports they need. And I guess just another big piece that I think is so important, and I've sort of said it in these top tips for health from a social determinants of health perspective, is about income. And certainly this legislation isn't even looking at that, and that's another reason why it should be referred to committee, because we know that in societies where there's greater income inequality, then you have greater health needs, there's greater social problems, all that thing. And governments have the tools to actually create fairness and justice. And certainly it's no magical solution. It's called progressive taxation, fair corporate taxes, robust public programs that are universal in nature, that support all Albertans. These are the things that are fundamental to creating equality in society. Unfortunately, this legislation speaks nothing of that, but this is what is needed in terms of people's health. And this is the Health Statutes Amendment Act, and the government should be moving on that, and instead they're tinkering at the edges, just doing minor changes to the Mental Health Act when fundamental ones are needed. Certainly we know that in Alberta, we have the greatest income inequality of any province in Canada. And believe you, Mr. Speaker, this is nothing to be proud of. This is something to be very distressed about, because that means that the gap between the rich and poor is getting greater, and with that, more costly outcomes in terms of our health system, and certainly more social distress. And we know that when people can't afford housing, when people can't get good jobs, then they often have negative health outcomes that go along with that. And certainly during a pandemic, that's when we need affordable housing so people can properly socially distance. But unfortunately, this government doesn't see fit to provide that. We know that the rent supplement program was suspended over a year ago, and there's millions of dollars on the table with the federal government right now that is being ignored. And many people could use that money in their pockets to be able to pay for affordable housing.
Standing Order 29-2A is available if anyone has a brief question or comment for the member. The honourable member for Edmonton Decor has the
Well, thank you, Mr. Speaker. You know, I'm always in awe with some of my colleagues, the different backgrounds that they have and the perspectives that they can bring to the table and, quite frankly, to this House for each and every member to be able to consider when looking at the legislation that's before us. I did find it very, very interesting when she was talking about the different aspects of how, I guess, our situations in life can influence the directions that we take and the consequences, quite frankly, that Albertans can incur when essentially not being able to make decisions that they would really like to make in order to be able to have a healthy lifestyle, have a good lifestyle, be able to provide a good environment for their kids. And so I was hoping maybe with some of her experiences in her profession before coming to the legislature, some of the things that she's seen where when people are afforded these types of chances to make these decisions, what were some of the outcomes with that? And maybe even some situations where because of not being able to make that, these decisions then negatively influence them, and thus even creating more hardship for them. I was hoping maybe she might be able to bring some perspective to that.
The honourable member for Edmonton Riverview.
Thank you, Mr. Speaker, and thank you to my colleague from Edmonton Decor for the question. And, Bill 65, Health Statutes Amendment Act, certainly sort of gives the title at least talks about the health of Albertans, and I would think any government, and this government included, would want to make sure that the changes they're making are helping Albertans. But I really feel like this legislation is really, I guess, perhaps poorly timed is a nice way of saying it. We are in the middle of a pandemic, and there are so many significant issues happening in our society that are just ignored by this legislation, even though they're opening, 6 important pieces of legislation. And certainly the committee that this is referred to could look at that and take a second go around to see how this could be improved. And certainly, as the member asked me, there's certain things that governments can do that can really be game changers for people's lives. And I have referred to some of them, but I'll just maybe start with, housing. That's so fundamental. And certainly when I was a social worker in child welfare, when I could support a family, often a single mom, to be able to have, safe, appropriate housing for her children, her situation could be stabilized much more. She wasn't couch surfing, perhaps, in a dangerous situation that may have caused her injury or caused difficulties for her children that would cost the health system more, where she could be in a safe place and care for her children and have the, the comfort, I suppose, and just the stability to be able to focus on caring for her children. And oftentimes when people have stable housing, then they're able to get a job. And that job is stable, the children are stable in school. All of this has spiraling effects that create much more health for a family system. And we know that there's so many, there's a human rights argument, of course, but there's also an economic argument to all of this. We know that when people don't have appropriate housing, then it can cost more in our justice systems, in our health systems, in our policing systems. It can, besides the emotional cost, and then of course, I've already talked about that extensively in my comments about, very vulnerable Albertans who are, losing their lives due to the opioid crisis in our province, and, having a harm reduction model, having harm reduction services available to people can save their lives. They don't want to die. People are in difficult circumstances and they very much want to stay on this planet, but they need the support of government, and government should be providing that support to stabilize the situation.
Honourable members, are there others wishing to speak to the amendment? The Honourable Member for St. Albert.
Thank you, Mr. Speaker. It's my pleasure to speak to the referral amendment for Bill 65, Health Statutes Amendment Act. And, I just want to echo a couple of things that my colleagues have highlighted this evening. And, it is somewhat disappointing to see. I think that we can all agree that we have limited opportunities to debate legislation, or for the government to bring forward legislation and for us to debate. And it's unfortunate that in the situation that we are right now, where we're in a pandemic, obviously, and we are in an economic crisis, the likes of which we've not seen for a very long time, and that this is what they're choosing to do again, is to use a piece of, to use this time to pass an omnibus bill that certainly cleans up a number of problems, but I think it's important to note that these problems are of their own making. And so I wanted to quote, there's a person on, I think we've all looked at social media at some time, and there's a woman on Twitter, her name is Lorian Hardcastle, and she made a statement, I think it was about a week ago, that I actually remembered, and I meant to write it down, so I had to go back and look for it. And it really sort of sums up what I'm thinking tonight. She said, "Government could have put forth the bill that better prepared us for the next public emergency and incorporated lessons from COVID. And this bill, Bill 65, is not that." And she is quite right. She is quite right on a number of fronts. And so, obviously, this bill, being a piece of, an omnibus bill, does a number of things. It amends and fixes quite a few mistakes. It amends, makes some changes to Pharmacy and Drug Act, Health Professions Act, Alberta Evidence Act, Crown's Right of Recovery Act, Mental Health Act, and the Health Facilities Act. So I do want to touch on, first of all, the piece around the Alberta Evidence Act. And as a few people have noted, one of the things that this piece of legislation does is it takes it addresses one of the recommendations. So you've heard us talking about the fatality inquiry, and the fatality inquiry that was done by, and the person actually who died, her name was Sharon Grace Lewis. And the fatality inquiry that was done, there were actually 8 recommendations. And the only recommendation that this piece of legislation addresses is recommendation number 8. But what I really want to point out, and for those of you that haven't had a look at the fatality inquiry, I would suggest there's lots of time this evening that you have a look at it, because there are 7 other recommendations that I think are vitally important. And I just wanted to touch on a few of those. And I find it incredibly disappointing that the 8th one is really the only one that is addressed in this piece of legislation. So the first one was around developing, and I can give you a brief overview, as the woman died actually at the Royal Alexandra Hospital. Certainly she had a lot of struggles and issues. She was intoxicated. She died actually in the emergency bay, I believe. I believe she was even tied to a wheelchair. Yeah. Anyway, this first recommendation encourages the development of policy around assessment for people in custody while they're waiting for programs and assessing them for those programs. That is incredibly important, given if any of you have worked the front lines or have worked in that sector at all, understand how patchworky our system is. That often it's difficult to refer someone to a program. It's very difficult sometimes to get someone in when you need them in quickly. It is, at best, it's an oversubscribed program. So obviously, it makes sense to me why the government would not focus on recommendation number 1, because that would entail them having to look a little deeper at what the problem is and where the investment needs to happen. The second one, obviously, was around a reliable database on the microsan misuse, and that is the disinfectant sort of hand cleaner or sanitizer. The third one I thought was really important was around addiction education for all patient care units. Now, that would include, the report mentions not just emergency services, as you would imagine, or the security services, as they played a role in this, but also included ICU and included all of the other units in an active treatment hospital. Now, again, addiction education is a lot more than recognizing when there is an addiction or recognizing what an addiction looks like or how it presents, but it is far more than that, because it's understanding the problem, it's understanding where that problem comes from, and then it's understanding where do you go next? What are the programs? What are the tools that we have at our disposal? And once again, I think what this says to me, the government's refusal or failure to address these other recommendations, but only look at this one as it results to accessing quality assurance records and proceedings and recommendations, they've really failed to address, I think, what is the body of the fatality inquiry. Again, it goes on to talk about another recommendation around accelerated discharge plans, more around education and the Mental Health Act, and again, about discharge coding. And so I don't know if anyone in this chamber has ever been involved in any discharge planning of any kind for someone with a mental health concern or an issue similar. That it is actually a complex process. It is more than just, let's say, after surgery that you're released home and then, you might be attached to home care, so they're doing perhaps wound care or you're getting a prescription sent somewhere. Discharge planning for people with pretty complex mental health issues or addiction problems is actually a form of a treatment plan, and a successful discharge plan can really mean life or death for somebody. And so while I appreciate the government's move to ensure that fatality inquiries have access to information from health system quality assurance committees that would support more comprehensive reviews and better recommendations, I question their failure to look a little deeper instead of just the surface of the fatality inquiry. Of course, the fatality inquiry is important, but to look at the substance. And the substance of this particular fatality inquiry and the basis of these 8 recommendations are based on a woman's life and her death. And our failure as a society, a collective failure, if you will, to have the supports that people like this woman needed at that time. So I just wanted to say that about the Alberta Evidence Act. And I think it was my colleague from Edmonton Whitemud who said it, is that there are so many things that we could be doing and changing and amending and making stronger, especially right now. We know there are so many problems, particularly as it relates to mental health, that this is where we're focused is a missed opportunity to me, is actually quite sad. So, it's incredibly disappointing, actually, that during a time that we have seen, I think that we have learned so many things in this last year, it's more than a year now, in this last 14 months, we've learned about where the weaknesses are in the different systems that we all have come to know far too intimately. We have learned what needs to be strengthened. And still, at this late date, we are seeing legislation that is not addressing the very real, very large, significant problems in front of us. And that, to me, is incredibly sad. So some of the other things, as my colleagues have said, that this piece of legislation changes around the Health Professions Act that would allow pharmacists and pharmacy technicians to treat herd animals. Now, far be it from me to diminish the role of pharmacy technicians and pharmacists to treat herd animals. I'm sure that is essential for their health and well-being. I'm sure it is essential and will actually be positive for that particular profession. And that's great. I'm just saying that when you have a limited amount of time to make changes to legislation that impact the lives of Albertans, that you would think that the government would look at it and say, what would make the biggest difference for the largest amount of people at this particular time in our history, at this particular time when we are struggling with things that we have not in our lifetime experienced. But no, this is where we're going. The other thing that this piece of legislation does around the Pharmacy and Drug Act modernizes the way that Alberta College of Pharmacy oversees pharmacy operations and practices. Now we understand that the amendments are supported, actually, by the college, which is great. I am glad that, looks like the government did do some homework and reach out to stakeholders, which is not their typical MO, but, surprising, but that's a good thing. Another piece that this piece of legislation looks at is the Crown's Right of Recovery Act. So there are 2 consequential amendments in this act. The first is that it adds a provision so that when the government joins an injured claimant's lawsuit, ultimately ends up being unsuccessful, the government's only responsible for paying the additional reasonable costs related directly to recovering the cost of health services provided to the injured claimant. Great. Second, removes an automatic fine for automobile insurers who fail to submit their annual premiums report to Treasury Board and Finance. Now, I thought it was a bit strange at first why this particular change would be in a Health Statutes Amendment Act, but it is because premiums collected and reported to Treasury Board and Finance is then used by Ministry of Health to determine health premiums that is charged on auto insurance packages. Now, what I would like to say is that that's all well and good. Government is choosing to make this change and alteration. But the first time that we're talking about changes related to insurance, as my colleague said earlier, what is incredible to me is that the first opportunity to address things in the insurance industry, and this is where they're going, Mr. Speaker, when we know that the vast majority of Albertans are not very happy because on average, their premiums have gone up 25%. Now, Alberta drivers have seen over the last year, last 14 months, they have seen their rates skyrocket. They've seen them skyrocket at a time where they're not using their vehicles as much as they used to. Often they're parked. I think I heard someone say it was, a couple £1,000 paperweight. It was just sitting there. People are home a lot more. And although there have been some alterations for some people, the vast majority of people are being forced to pay far higher rates. Now that is because, we all know this, that the government removed the cap that had been put on by the previous government, NDP government, and now insurers are allowed to raise rates. So that was removed last year. Now, once again, this tells me this is, you have to be a rocket scientist to figure out whose side this government is on. Honestly, anytime there is a change, the first thing that I always think of is, how is this going to benefit Albertans? And typically, when I ask myself that question and I look at the legislation and I dig a little deeper, typically it is not the vast majority of Albertans that will benefit. And this piece of legislation, I think, is really some evidence about that. So, it's incredible to me that in a time that we're in, and I'm sure that we will look back on this one day and sort of, shake our heads and try to remember what that was like. It was such a strange and difficult and challenging time when so many people have died, and so many people have gotten sick, and so many people have lost their jobs, and so many people have just lost so much in terms of their families, in terms of their regular lives, at a time when we should be laser focused on doing everything that we can as legislators to make life better for every single Albertan. That is not what this legislation does. This legislation, as I said earlier, this legislation is a mop-up job of some mistakes or some things that needed to be cleaned up. And then the one little attempt to meet some recommendations I think that are actually vitally important, as outlined in the fatality inquiry that I talked about, the government chose one out of 8. One. It looks like the easiest one. I am not a lawyer. I am not, I was not a part of this inquiry, but.
Thank you, Honourable Member. 29-2A is available. I see the Honourable Member for Edmonton Highlands Norwood has risen.
Thank you. Thank you, Mr. Speaker. I was very much enraptured by the comments of my colleague from St. Albert. And, I was thinking about actually the comments as well from my colleague from Edmonton Riverview. And my colleague from Edmonton Riverview spoke a lot about, the opportunity perhaps that this government had with this legislation, particularly in the area of mental health. And that's something when I have a moment to talk to this bill, I'm going to dig in deeply. But that member talked about, the need for investments in harm reduction and in housing, and how, these superficial housekeeping changes aren't what's needed. What's needed are investments. And because I know my colleague from St. Albert and Riverview have a lot of overlap in their files when we're talking about supports for folks who are marginalized and investments in housing and mental health and harm reduction and all the things. I just wondered if she maybe wanted to speak to that piece a little bit, or anything really.
The Honourable Member for St. Albert.
Thank you, Mr. Speaker. So as it relates to this piece of legislation, so Bill 65, this omnibus bill, one of the things that I think that was so alarming about the fact that this government chose to only pick one recommendation out of this fatality inquiry almost feels like they didn't pay attention to the rest of it. And the rest of it paints a picture of of some of the problems that we have. So we know that substance abuse is a killer. It is a huge problem. We do not invest enough money in all types of programs, not just residential programs, but harm reduction. But even more than that, we don't support people to actually live with dignity. We don't support people financially so that they can actually live above the poverty line and afford a place to live that allows them just the modicum of dignity to buy food properly. I mean, you have the vast majority of people on income support. Now, let's be straight up here. People that are living on income support are poor. They are the poorest of the poor. They live on core benefits that are under $900 a month. These are often people that have struggled with employment, many of which are related to substance abuse problems. These are people that are living in poverty. They can't find homes to rent that are affordable, that aren't infested, that are accessible. That is just the state. That is just the state of poverty in the big cities and in small communities. It's not just the big cities. And so when I see a fatality inquiry like this that is such a clear example of what happens when somebody falls through a crack as big as the Grand Canyon, and that's what happened to this woman, it is a tragedy. There are 8 significant recommendations to make the system a little stronger and a little more responsive, and this government chose one simple one to check off a box to say, yeah, look at us, we did it. Omnibus bill, we're going to meet a recommendation of fatality inquiry. And it's an easy one because the more complex ones deal with the complex problems of substance abuse, of poverty, and of all of the issues that are described in the inquiry report. It's very clear because the Royal Alexandra Hospital is an inner city hospital. They do see examples of this every day, I'm sure. And so I would encourage the members who are, doing whatever tonight, take a few minutes and read the inquiry yourself. It's only about 26 pages. And then ask yourself, why is it that you are on the side of a government that chose to focus their attention on an omnibus bill on this particular recommendation? And why fail to address the other ones? Because the other ones are more complex, and the other ones force you to look deeper, and the other ones force you to address problems that this government has demonstrated time and again they will not address properly. And so, I would just say, government members, you don't have to vote the way you're told. You don't have to do the things you're told to do. You have a voice. I would suggest that the government members maybe use that voice and try to influence your government, your leaders, to do the right thing.
Thank you, Honourable Member. I see the Honourable Member for Edmonton Decore has risen to join debate.
Well, thank you, Mr. Speaker. Appreciate the opportunity this evening to rise, add some, additional comments to Bill 65, the Health Statutes Amendment Act, Spring 2021, and of course, speaking more specifically to the referral amendment, which says that we need to send this to the Committee on Families and Communities. So, Mr. Speaker, I have to always say the perspective that, my colleagues here in the official opposition always bring to the House each and every day, I think really helps us as legislators to potentially bring forward legislation that will help Albertans. All we have to do is listen. And so some of the opening comments that I heard in the debate this evening, of course, was around the number of changes that we're seeing, of course, in Bill 65, which is 6 pieces of legislation that's being changed, which is, as we know, omnibus legislation. Now, I have to admit, Mr. Speaker, I'm consistently getting very frustrated on this topic because I distinctly remember members of the government bench, members of the government caucus who served in the 29th legislature, got up and furiously opposed what they thought was omnibus legislation. And I'm specifically talking about the changes to labor legislation that was proposed back then. And so if we're looking at Bill 65 and the number of changes this was made, and you have that level of opposition to omnibus legislation, why are you presenting this as omnibus legislation? And you know, this is not the first piece that we're seeing this like this, Mr. Speaker. And so I can only conclude that that was never actually a belief that they held to begin with. They were simply opposing for the sakes of opposing. And so I think just on that grounds alone, we should send it to committee to find out if indeed omnibus legislation is supported as a means of bringing forward legislation, because certainly, like I said, in the 29th, that was just unacceptable. And that was only one ministry, not necessarily multiple ministries. But there is very good reason, I think, besides that, to look at exercising the referral amendment to families and communities, because there's questions in Bill 65 that need to have answers. And the only way we're going to be able to explore that properly is through the committee, to be able to hear from stakeholders, to be able to hear from the public, to be able to hear from experts why this is either good or, in essence, if it is bad, how we can change it to maybe, well, potentially make it less bad, as members opposite used to love to say. So, I mean, even the title itself, Health Statutes Amendment, and as my friend from Edmonton Gold Bar had initially pointed out at the beginning, we have changes to insurers, to automobile insurers. How is that related to health? We're in the middle of a pandemic. We're trying to get vaccine to everybody. We're trying to figure out ways to support frontline workers. We're trying to keep kids in schools. But hey, you know what? Let's give the insurance companies a break filing papers late. I don't know, maybe we should all ask the ethics commissioner, hey, if I file my disclosure late, can you give me a break on my penalty? I'm betting the answer will be no. But nonetheless, fine, let's explore this. So why is it then that we would need to waiver these penalties? What's the reasons? Because when I look here in Bill 65, and on page 3 under the Crown's Right of Recovery Act, I don't see anything with regards to that. It reminds me of my times, you know, back in my old profession, and I would constantly have you know, not only battles with other employers, but even my own employer around that whole aspect of, well, it's an emergency. Well, you know, Mr. Speaker, an emergency would be a fire, an emergency would be a flood, an emergency would be an earthquake. But yet, nobody was ever willing to actually put that on paper. And I'm kind of seeing the same things here with Bill 65. So let's go to committee, let's explore either why you're excluding it, and if there's a very good reason, I'm willing to accept that. I suspect not, because this simply tends to be ways to just come up with excuses to not be able to have to do things. And so in a time like some of my colleagues have mentioned, where Albertans are seeing significant increases in their insurance premiums, sometimes even decreases in the amount of coverage that they're getting, because the premium is so high, they're trying to find ways to save money, because with other legislation that we've seen come forward in this House, has made their lives considerably more difficult, has made their lives considerably more expensive. Throw a pandemic on top of even that. But yet, we're going to cut some slack here. So I'm curious to know, again, if we send this to committee, it'll be a fantastic place to be able to answer these questions, something that, as some of my colleagues had mentioned, members of the government benches, members of the government caucus in the 29th legislature were adamant about doing. Sending legislation to a committee to be looked at, to be studied, to consult stakeholders time and time and time again. Now all of a sudden it's not a good idea potentially? So which is it? But let's find out by waiving these late filing penalties for auto insurers, how that's going to benefit Albertans. I would love to have the auto insurance company say, you know what, with this change, the member for Edmonton Decor, his constituents will see lower premiums because of it. Because so far all I've seen is their premiums going up, time and time again. You know, why remove, I guess, those incentives to not file late? And I'm curious, what's going to be the time frame that's going to be acceptable? I don't see that prescribed as, you know, well, you're late by a week, we're gonna waive the fees. Oh no, you're late by a month, we're gonna waive the fees. You're late by 10 months. Yeah, we'll waive the fees. What's the limit? What's the line that's being set? That once it's crossed, it's, yeah, sorry, no waivers for you. Because I'm not seeing those type of things prescribed in Bill 65. And maybe through the committee, exploring how maybe industry itself says, well, yeah, there is a time cutoff here that, yeah, that's reasonable, that's expected. Kind of reminds me of the recent changes I saw around the employment standards of allowing employers to not record hours daily. That's in Bill 62. Which on the surface looks okay. But the problem is there's nothing beyond that. So if an employer does it just once a year and does it every year like that on that same day, technically that's regular. So it's all about the language. Or, in this case, the lack of language. So what is going to be acceptable around that? And I know there were significant concerns around the fatalities in inquiries. And some of the recommendations were there. And I don't, if there's information that the government can table at the committee by referring to it, we'll be able to examine that and see if that is indeed reflected within Bill 65. And that's not necessarily, did the legislation reflect what you've heard? I have to say, Mr. Speaker, I've heard the government say over and over again on various pieces of legislation that have come forward in this House. Oh, we consulted thoroughly. Okay, where's the information? Oh, we consulted thoroughly. I guess that same challenge stands, that, if you consulted thoroughly, you have the information to present it, and shut me up and sit me down. So with these 6 changes, I have to admit, there's a couple of, I guess, minor changes. And, my friends from Edmonton, Riverview, and St. Albert talked very thoroughly, I guess, about the lost opportunities, changing things like the Mental Health Act, for instance, and what could have been done. Maybe if we send this to committee, like the referral motion is saying, we would get an opportunity to look at that and say, here's a great chance to add these in here. Maybe it's not necessarily something that's big in terms of the legislation, but could be big for people across the province. And I think about that story that my friend from Edmonton Riverview was talking about. Every 6 months, having to go through everything again just to be able to stay in the facility that's helping. Almost sounds a little bit like red tape. Maybe we should send the red tape minister after that. And quite honestly, then, if what I'm kind of hearing about two of the changes that are made around the Mental Health Act and the Health Facilities Act, just kind of sort of minor housekeeping, I'm surprised it didn't get handed down to the Minister of Red Tape, because that always seems to be what's been happening. $10.5 million being spent on hand-me-downs from other ministries. So I'm a little surprised that maybe he didn't get a chance to present these things. But it sounds like there's an opportunity for the minister to maybe reduce some red tape in that area. Let's send it to committee. Let's get some stakeholders in to talk about the opportunities that lie there. The Associate Minister of Red Tape Reduction can come in, listen to those, go back, and get some real tangible action done. Maybe we won't have to have 6 months intervals with which to constantly have to reapply. Gosh, that almost sounds like the story I heard from a constituent one. Served in our military, unfortunately, lost a leg during that service, but every single year has to fill out paperwork to say, yeah, the leg hasn't grown back. I mean, when you have Albertans that require our help and our support, and we know full well that's not the case, that it's going to change, then let's make it easier for them. So there's opportunities there, if we can send this to committee, to be able to explore those things. And then all of a sudden you'll have a piece of legislation that's going to be very, very powerful and very meaningful to Albertans, because it will actually help them change their lives for the better. That's supposedly what we've been sent here to do. Not make their auto insurance more expensive and let the auto insurance company off the hook because they can't file their paperwork on time. It's funny because I have a feeling that if there's paperwork that I have to file to my auto insurance upon request, they're not going to accept if I file it late. Or they'll probably just cancel my policy. So I think we have a chance here. I want to look a little bit here at the Alberta Evidence Act. And why is it we're willing to make these kinds of changes? And I'm not necessarily saying that that's a bad thing. Providing more information so that a proper judicial decision can be made.
Thank you, Honourable Member. 29-2A is available, and I see the Honourable Associate Minister of Mental Health and Addictions has risen.
Thank you, Mr. Speaker. By listening to some of the members opposite talking about their comment to this Amendment Act, and also raising a number of issues related to our Alberta's current mental health status and some of the current legislation we have, I can't help by wanting to stand up and educate those members. Seems to be to me that they were talking something so abstractive with very little specific information. So I like to address the House in 2 points to have everybody see the fact here. The first about what this amendment is all about. It's really about balancing the power of the Minister of Health so that he doesn't have the previous power that through a government order can replace the legislation process. The second one is giving people choice for taking vaccination as their decision as versus a mandatory one. But the opposition keep bringing up about other issues like mental health act and mental health sort of needs and so on and forth. I'd like to have this chance to give the House an update of where we're at. In Alberta, with this new government, we have committed unprecedented dollars for $140 million new dollars to improve the mental health and addiction system in Alberta. It is this new government that created an office, which I'm very privileged to be the first one taking on the responsibility to advance the cause and address the rising needs of mental health addiction in Alberta. With that $140 million, we have committed increase 4,000 treatment spaces. And this is a significant change from where before we took office, people are waiting weeks and months to get into treatment, and they are congregated at streets and other places that they are enabled to get out of the addiction cycle. With our government, we have set a very strong focus that we're going to focus on recovery-oriented continuum care. We're laser focused when we get involved helping Albertans. Our purpose is to help them get well, get out of addiction, get into treatment. And this is a sharp contrast to the system that we inherited from the previous government. They have so many different broken pieces, and each program services existed on its own without a vision, without a focus. And people in the field are saying, I happen to be a social worker that have worked in this part of the field for many years. People are saying the system is so complicated and so difficult to understand that it takes a degree to figure out how to navigate that system. So that is a clear indication how the previous system failed Albertans miserably. But we have, since we take office, we have put that focus. We're developing this recovery-oriented continuum care. We cover all the way from prevention, intervention, treatment, and post-treatment recovery support. We're gaining notion across the country that the so-called Alberta model is the one that cutting edge, is making remarkable changes in the system. In fact, in the coming Council of Federation symposium this year, in the coming weeks, this is the Council of Federation. They dedicate this year's symposium focused on mental health and addiction. And the Alberta model will be very well demonstrated and described there. I believe I'm already getting phone calls from my counterpart from Ontario, Manitoba, Saskatchewan. They are really interested to see the development that Alberta model is shaping and leading the country. So, folks, let me correct the record that when we have a system working, when we have robust regulation, Mental Health Act in place, there's no need to really.
Thank you, Honourable Associate Minister. Members, to join debate, I see the Honourable Member for Edmonton Highlands Norwood has risen.
Thank you, Mr. Speaker. And I thank the Associate Minister for his thoughts as well. I'm very much looking forward to commenting on some of that shortly. It is, of course, an honor to rise and speak to Bill 65, the Health Statutes Amendment Act. And, you know, I want to start my my comments by just, as I said earlier, kind of just framing this in the broader discussion about healthcare. And, you know, it's again this government has had, and I feel like a broken record at times. Although now that's reminding me, I said broken record not too long ago, and somebody said that people nowadays, young people nowadays, might not get that reference, But as someone who doesn't yet qualify for a vaccine, I feel like if I get it, I'm sure most people in this chamber get it. Anyways, I digress. I was saying that I may feel like a broken record in the sense that I've multiple times stood in this house and you know, reminded this this government that, you know, they've had the opportunity at so many occasions to make real positive change in the midst of a pandemic. And I've stood here multiple times and said, you know, this is a real opportunity to examine the systems around us, to examine the gaps, not just in healthcare, but in social services, in the you know, the safety net that we offer folks, particularly marginalized folks, and they failed to do so. I mean, we saw earlier tonight one of the first examples of this government taking one of our recommendations seriously, and that was with the passing of Bill 71. And don't get me wrong, I'm absolutely elated that this government was willing to accept that suggestion, led by our leader and by the member from Edmonton Mill Woods, because as that same member from Edmonton Mill Woods commented earlier, you know, this is really critical, especially for essential workers and folks who you know shouldn't have to choose between getting a vaccination and potentially, you know, being reprimanded or facing issues at their workplace. And so I can't help but think, and I mean, this move is being applauded by folks all across this province. And you know, I'm not here to lecture this government, well, I guess maybe I am, but you know, think about the number of times in opposition here we have proposed amendments to bills, you know, not just amendments like the amendment we're on right now or referral, but well-considered amendments that would have improved pieces of legislation. And I think, you know, in this session, I don't even know how many amendments have been accepted, maybe one. I could even be being generous with that. I still remember it was eye-opening for me in our first term, you know, just after being elected in April of 2019, our first term there, you know, presenting multiple amendments, introducing multiple amendments on Bill 8, right? That was one of the big first pieces of legislation that I was fairly, you know, intimately involved with. And to see just amendment after amendment that had been based on consultation, that had been, you know, based on evidence and were well thought out for those to all be denied by this government. And so I guess I start my comments by noting that, you know, Bill 71 could be a turning point for this government if they were willing to listen more. And, you know, I think about the number of times in this House where, you know, the Premier and others have said we're being divisive and said we're, you know, said various things. And, you know, in so many cases, we're not being divisive, we're being propositional, and we're opposing pieces of legislation, we're opposing actions by this government because we know that they can do better, because we know that there are alternatives, but they're not willing to listen. And so I guess, you know, maybe I'm feeling hopeful. I'm seeing all my, I almost said elderly, all my elderly friends getting vaccinated. No, I don't mean that. I'm seeing my, there we go. I'm seeing my, how do I say it? My older, my older, okay, thank you. My older friends being vaccinated, and maybe it's with, there's some hope and a spring in my step that perhaps, again, this is a turning point, and we will see more of this collaboration from this government. I still have my youthful optimism, you can see. But let me get back to Bill 65 and get to some of my specific concerns. And again, you know, I was talking about how just healthcare generally, you know, we've seen a pattern from this government where they've not been, you know, willing to, instead of taking the necessary steps to really improve healthcare, public healthcare in this province, they've chosen instead to attack it. And we saw that with attacks on doctors. We saw that on, you know, the cuts to rural healthcare and healthcare workers. The list goes on. And again, I just want to echo the comment earlier that this government had an opportunity with every piece of legislation to really make tangible, significant changes, especially when it comes to healthcare, especially because we are in the midst of a pandemic. And like I said earlier, that should compel us to make perhaps broader, more substantive changes. But they're not doing that. Instead, they've got pieces of legislation like this one. Now, I want to build on I guess, you know, a few pieces that are really relevant to me as the MLA for Edmonton Highlands Norwood. My colleague from Edmonton Riverview gave a really good overview of the fact that, you know, the Mental Health Act, and I want to build a little bit as well on what the Associate Minister talked about. And, you know, he talks about, oh gosh, he talks about how, you know, his government is taking these issues seriously, and previous governments have failed and whatnot. And you know, that his approach, or I shouldn't say their approach to folks struggling with mental health and addictions is one of recovery. And you know, I asked that minister and then this government to talk, and to maybe not to talk, to analyze the data that we're seeing. You know, we've urged this government many, many times to take an evidence-based approach to mental health and to addictions. And of course, we talk about harm reduction, which has become a bit of a dirty word with this government. Let's look at the latest numbers just from a story released yesterday. Overdose deaths continue to spike in Alberta during the first 2 months of 2021, with 228 opioid-related fatalities. 153% increase compared to January and February of last year.
Yes.
So, and this also shows that the majority of opioid overdose deaths took place in Calgary and Edmonton, in the largest cities, with 70 and 72 fatalities respectively in those two cities. So you can see the vast majority taking place in those cities. And these numbers follow Alberta's deadliest year on record, which was last year, with 1,316 drug-related deaths, over 1,100 of which were opioid-linked. And so, you know, I'm not sharing these numbers to be sensational. This is the fact. These are the facts. These are the numbers we're seeing. We're seeing, of course, due to the pandemic, we're seeing so many issues being exacerbated. We know that the illicit drug market has been fractured. We know that folks have been using in isolation. We know that there's limited access to services. Yet, we're not seeing tangible action from this government. And I can tell you, this is not just you know, these are not just numbers. These are human beings. These are the lives of people who had stories and who had so much to contribute. And you know, I'm certain he has, but I'd love to encourage him again, if he hasn't, to take some time perhaps to. And I'm speaking through you, of course, Mr. Speaker, to the Associate Minister, to perhaps, you know, take a walk through some of the neighborhoods that I represent, Boyle Street, Macaulay, you know, I shared this the other day that I had just been out with, I've been out with two organizations that are doing a really cool on-the-ground work, necessary work because of gaps in services not provided by this government. Bear Clan Patrol and Water Warriors. I went out with Water Warriors last Thursday, in fact, and basically what they do, if you don't know about the work that they do, is they take a harm reduction approach. They're all equipped with naloxone kits, and everybody is trained. I've been trained on that. If you haven't been trained, I encourage you to do so. And they handle supplies to folks in need. And the need is through the roof. Food, the need for food, for water, for clothes. They have multiple carts full of food and water. They also have a truck that's full of clothing and shoes and whatnot. And oh my goodness, the number of people we saw last Thursday, it was a nice evening, admittedly, but the number of people we saw who didn't even have shoes. One lady had one shoe, and I said, "Oh, you don't have two shoes, do you?" And she said, "No." I said, so we went through and we tried to. She had really wide feet though, and it was really hard to find her shoes that would fit her. And the number of folks we encountered who were struggling with mental health and addictions, and I see this every day. You know, I see it every day in our neighborhoods. We know that it's not getting any better. The numbers are clear, and again, it's not just in the inner city that I represent. Of course, I'm just using my own personal experience. We know it's in small communities as well, absolutely. But we need evidence-based solutions. And what are the experts asking for? They're asking people who are on the front lines. They're asking for things like safe supply. They're asking for things like investment in harm reduction, right? Yet this government is so ideological that they're not. And I'm concerned, you know, I don't want this to be a "we told you so" sort of thing. I don't want to have this conversation with this minister a year from now, same time next year, and show that, oh, look, numbers are through the roof again. I want to be wrong, absolutely. But I'm fearful that without investments in harm reductions, without concrete investments in mental health, this means hiring more workers. This means giving more supports to those frontline organizations. When I was out with the crew the other night, last Thursday, we went the route. We started at the parking lot of Rogers Place. And of course, if anyone's been there, the juxtaposition between Rogers Place, I have to admit that's just outside my riding, across the street essentially. It's my colleague from City Centre is riding, but the juxtaposition of Rogers Place, you know, that beautiful facility, with Boyle Street Community Services right behind it, and the number of folks outside Boyle Street Community Services looking for services. Anyways, went to those two places, then we went over to beautiful Edmonton Highlands, Norwood, and stopped at the Bissell Centre, stopped at Hope Mission, and George Beatty Centre. And again, that was a nice night, but throughout the winter, any night you could go -30 outside Hope Mission and see a large crowd of folks outside George Beatty, outside Bissell Centre, along the LRT line, anywhere in those areas. And so, you know, I share all this because we need more than just housekeeping changes to the Mental Health Act. We need concrete action from this government. And I want to believe that we're going to see, you know, that minister and this government removing.
Thank you, Honourable Member. 29-2A is available. I see the Honourable Minister of Justice and Solicitor General has risen.
Thank you, Mr. Speaker. Mr. Speaker, I rise to just provide a brief response to, you know, what we have heard tonight about, with respect to Bill 65, the Health Status Amendment Act 2021. You know, Mr. Speaker, I just quickly wanted to remind the members of this assembly what really Bill 65 is all about, because oftentimes when we are in debate, listening to the members opposite, and commenting on, speaking on the bill before us, you would think that indeed that all of their comments are centered or focused on the actual content of the bill before us. But, and I like to think that, the members opposite, means well when, they rise to speak on this bill. But again, I don't want, our fellow citizens listening from home or wherever they may be at this point in time to be misled about Bill 65. First and foremost, this bill amends 6 pieces of legislation, beginning with the Pharmacy and Drug Amendment Act, that would clarify the accountability requirements of all pharmacy ownership models to increase compliance with legislation, regulations, and licensing, helping to ensure the pharmacy system continues to operate safely. And amongst other things, it would also move the requirement for physical facilities, pharmacy areas, and dispensing areas from regulations to standards of practice to be more responsive to changing patient needs and the evolving practice of pharmacy, amongst others. The second piece of legislation, Mr. Speaker, is the Health Professions Amendment Act, Pharmacy. This particular piece of amendment will enable pharmacists and pharmacy technicians to continue to provide professional pharmacy services supporting animal health, providing Albertans who raise or own animals with additional options to access pharmacy services for their animals. Amongst other things, the need to give pharmacists explicit authority to provide services to animals has been prompted by changes made to the Food and Drug Act by the federal government. That's what essentially that particular amendment to the Health Professions Act seeks to do with respect to pharmacy. The third piece of legislation, which is a piece of legislation that I am responsible for as the Minister of Justice, but for which the particular subsection 9 sub 2 is the responsibility of the Minister of Health, although the entire piece of the Evidence Act is Justice's responsibility. That amendment would provide the judges at fatality inquiries with access to facts from health system quality assurance committees to support more comprehensive reviews, discussions, and effective recommendations. And this is pursuant to a recommendation by a justice of the Court of Queen's Bench sitting in fatality inquiry. Again, we are implementing the recommendations made by the justice of the Court of Queen's Bench that this is how we can improve our systems. The fourth piece of legislation is the Crown's Right of Recovery Amendment Act. Limits government cost exposure to reasonable amount directly related to its right to recover health care costs when it participates in an injured claimant's ultimately unsuccessful lawsuit. Amongst other things, the fifth legislation, the Mental Health Amendment Act, makes minor, very minor housekeeping amendments to correct section references, revises overly broad wording regarding retention forms to be more specific to what Alberta Health Services can report, deletes unproclaimed sections of the Mental Health Amendment Act 2020, and finally, Mr. Speaker, the Health Facilities Amendment Act makes minor housekeeping amendments, including removing outdated references to local welfare officer, since such positions no longer exist. And amongst other things, finally, returns reference to Part 5 in the Act that the government maintains authority for historical cases that arise, such as class action lawsuits. Mr. Speaker, this is what this law is all about. With that, I move that we adjourn debate.
We are under a 29-2A, therefore we can't adjourn debate in that manner. However, I see the honourable member for Calgary West and Government.
Well, it's okay. Well, thank you very much, Mr. Speaker, and I'd like to echo the last words of the honourable minister there, and I move to adjourn debate.
Having heard the motion as proposed by the honourable member for Calgary West, all those in favour of adjourning debate, please say aye. Aye. Any opposed, please say no. That is carried.
Under Government Bills and Orders for second reading, Bill 66, Public Health Amendment Act 2021, adjourned debate on amendment. Mr. Scow.
Thank you. Are there any honourable members looking to join debate for clarity? I believe we are on Hoist Amendment 1. So HA1. And I see the honourable member for Edmonton Gold Bar has risen.
Thank you, Mr. Speaker. I'm pleased to rise and offer a few comments on the amendment that is before the House with respect to Bill 66 this evening. And now, I think that it's important for me to clarify that there are, even though I'm speaking in favor of this hoist amendment, there are a number of things in Bill 66 that I think are positive steps forward with respect to public health legislation in the province of Alberta. Now, first of all, the bill, a lot of the comments that I will offer tonight are based on work by Sean Fluker and Lorian Hardcastle, who are some hardworking lawyers at the University of Calgary. They run a fabulous law blog called ablog.ca, and they provide a lot of insightful analysis on legislation. I'm disappointed in the name. I personally would have preferred if they'd called it Bob Loblaw's Law Blog. But we, there are so many missed opportunities in this world, and the lawyers at the University of Calgary certainly had missed one there. But I digress. Sean Fluker and Lorian Hardcastle have written extensively and very insightfully about the status of public health legislation in the province of Alberta since the pandemic has struck this province and a public health emergency was declared last year. And I think it's worth all MLI's time to read their writings, and certainly if they can't, then I'm happy to provide some of the highlights on their opinion on Bill 66. So certainly Bill 66 proposes to improve health legislation by explicitly confirming the authority for general lawmaking, but to expand, it broadens the wording of Section 29, Sub 2, to explicitly authorize the Chief Medical Officer of Health to prohibit a class of persons from attending school or work or having contact with others. So that's important, Mr. Speaker, because the current wording of the legislation makes it unclear as to whether or not the Chief Medical Officer of Health had that authority. And I think it's important that the public health measures, or that the public health legislation clarify that. Now, it's interesting, the authors of the blog note that these changes to allow a Chief Medical Officer of Health to prohibit a class of persons from attending school or work were changed in other jurisdictions, notably Ontario, way back in 2003, when that province was hit hard by the SARS outbreak that year. And I think it should concern all Albertans that it's been 13 months since the initial public health emergency was declared in this province, and we are only now getting around to addressing an issue of the Chief Medical Officer of Health's authority that was addressed by other jurisdictions in this country 18 years ago. I think there are many Albertans who are wondering why this government has done such a poor job of responding to the COVID pandemic. And we see in this legislation some hint as to why. They refuse to learn the lessons that other jurisdictions have learned from previous infectious disease outbreaks. And in fact, if the government had been paying attention 18 years ago, we probably wouldn't be standing here today debating this measure in the legislation. Related to that, of course, the bill provides some clarification that the Chief Medical Officer of Health can, in writing, exempt a person or class of persons from the application of public health orders. And I think that is also a common sense change to the legislation that is well overdue. One of the things that I would like to see, though, in this legislation is some kind of publication to the general public of the exemptions that the exemptions and applications of public health measures that the Chief Medical Officer of Health makes. We found out sometime last week on social media that AHS had provided exemptions to a rodeo to continue to carry out their event. They were exempted from whatever public health orders were in place that would have prevented that from happening. Now, I have nothing against rodeo, Mr. Speaker. And even though it's not yet the official sport of Alberta, I recognize that it is important to a great number of people in this province. But it's interesting to me that Alberta Health Services would issue an exemption for a rodeo, and that that the public of Alberta would find out on social media, through back channels of social media. I think it's only fair that if the Chief Medical Officer of Health has these powers to prohibit classes of persons from attending school or work or these other kinds of events, and also the power of exempting classes of persons from attending or from these kinds of public health measures, that all Albertans have the opportunity to see what prohibitions and exemptions to those prohibitions are being made, and have some rationale attached to those publicly. Maybe it was in the public interest to allow this rodeo event to occur. Maybe it wasn't. We don't know. All we found out was that Alberta Health Services had issued an exemption with no explanation and with very little public scrutiny. So I think this is one of the reasons, Mr. Speaker, that we should vote in favor of this hoist, because I don't think these measures with respect to the powers of the Chief Medical Officer of Health's ability to issue prohibitions and exemptions goes far enough in terms of public transparency. Now, one of the things that this bill clarifies, which is incredibly interesting to me, it clarifies the fact that the Chief Medical Officer of Health has the power to enact laws of general application under this Act. And it's astounding to me, Mr. Speaker, that we are actually considering this legislation that strengthens the Chief Medical Officer of Health's ability to enact laws of general application, when for the past 13 months, the Premier and the Minister of Health and the Chief Medical Officer of Health herself have asserted that the Chief Medical Officer of Health does not have these powers to enact laws of general application. Every time they've been questioned on what role the Chief Medical Officer of Health plays in creating and enforcing public health measures, they've all claimed that she's only an advisor. And in fact, due to the significant failure of this Premier and this Minister of Health and everybody else in Executive Council to effectively address the COVID-19 pandemic, there has been a public outcry demanding that the Chief Medical Officer of Health assert her authority given to her by the Public Health Act to enact laws of general application. And she has also refused to do so. I don't envy the Premier or the Minister of Health or the Chief Medical Officer of Health their position during this pandemic. The weight of responsibility that they bear in this situation, I think, would be a tremendous burden. But I think that burden must be made even greater with the knowledge that you could have enacted a law of general application that could have saved lives and prevent significant numbers of illnesses, and refused to do so, and maintain this charade that you were only an advisor to the Premier and to the Minister of Health. And it boggles my mind that the public message that we've heard time and again is that the Chief Medical Officer of Health is only an advisor, and it is properly the role of the Premier and the Minister of Health and Cabinet to enact the public health measures. And then we see these changes that strengthen and reinforce the Chief Medical Officer of Health's power to enact laws of general application. I would think that given all of that messaging that we've heard over the last 13 months, that we would have seen some amendments to the Public Health Act that would have actually reinforced the message that the Chief Medical Officer of Health is an advisor, and taken away her powers to make laws of general application. But that's not, in fact, what we've seen. And so I think for that reason alone, we should vote in favor of this hoist, because there's incredible dissonance between what the government says it does when it comes to managing the COVID pandemic, or mismanaging the COVID pandemic, more accurately, and what the law says it can do, and who can do what in these situations. So I think it's only proper that we vote in favor of this hoist and allow the government to go back to the drawing board and come up with legislation that at least matches with the public messaging that they've been giving the people of Alberta over the last year and a bit. Or, in the alternative, Mr. Speaker, I would encourage the Premier and the Minister of Health to talk openly about the powers that they've given the Chief Medical Officer of Health. And the next time that they provide COVID-19 pandemic updates to the people of Alberta, once this law is passed, if it's passed, tell people the straight truth, that the Chief Medical Officer of Health does have the power to make laws of general application. And that she is much more than just an advisor to Cabinet on this matter. Because the confusion about who is actually in charge right now has been one of the contributing factors to the disaster that COVID-19 has been to the people of Alberta. So I think it's right at this time to vote in favor of this hoist amendment and give the government the opportunity to rethink its position on the power that the Chief Medical Officer of Health has in these kinds of public health emergencies. Now, one of the things that this bill also does is it repeals controversial provisions in the Act that provides ministers with extraordinary lawmaking powers to amend or create legislation at will. And we saw early on in the pandemic the disaster that was created when we gave the Minister of the Environment the power to make legislation as he saw fit without even coming to the floor of the legislature for those changes. In the early days of the pandemic, the Minister of the Environment issued a ministerial order under the powers given to him by the Public Health Act to close a whole bunch of parks and public land use zones.
Thank you, Honourable Member. 29-2A is available. And I see the Honourable Minister of Justice and Solicitor General has risen.
Thank you, Mr. Speaker. Mr. Speaker, I just wanted to rise quickly to obviously respond to comments made by the member from Edmonton Gold Bar with respect to this Hoist amendment on Bill 66. Again, Mr. Speaker, the whole essence of debate on specific bills before the floor of the House is to really debate the substance of the bill before us. And I understand we come from different walks of life, different experiences, different lenses with which we look at things. But in this assembly, we are called upon to actually transact the people's business. And the people's business would require that we focus specifically on the bill before us. That's how, that's how our citizens, get to know that indeed that we are representing their interest. So Bill 66 is a product of the work of the Select Special Public Health Act Committee. That committee heard from experts. That committee heard from Albertans. More than 600 Albertans wrote to that committee. Experts from the Chief Medical Officer of Health Office, experts from Alberta Health Services, the Department of Health, and other civil liberties organizations. They all had the opportunity to weigh in on this bill. And that committee was set up as a consequence of the concerns that we heard from the people of Alberta, our people, around essentially Bill 10. And that committee then, at the conclusion of their hearings, produced a report that included the majority report and the minority report, authored by the members opposite. It is important to note that at the heart of the recommendations of the members opposite who sat on that particular committee and authored that minority report were essentially, four key recommendations, amongst the rest being background information. Number one, a recommendation to repeal Bill 10. This Bill 16, this Bill 66 have taken care of the specific concerns raised by the people of Alberta with respect to Bill 10. That matter is reflected in Bill 66. Listening to the members opposite, you would think that is not true. But then, the rest of the recommendation of the minority report, number one, has nothing to do with the concerns by Albertans with respect to Bill 10 that led to that committee. Number one, recognize the importance of universal public health care. That's their number one recommendation. Number two recommendation, a motion to legislate duties of government to deal with the opioid crisis. And number three, or number four, to set up the office of the Chief Medical Officer of Health to be independent in a way that it reports to the legislature. The members opposite would want us in the midst of a pandemic to begin to play politics with the office of the Chief Medical Officer of Health in the midst of a pandemic. And this Hoist amendment would say, push it forward to 6 months. Don't do anything. But these were the members that were almost lighting their heads on fire because of Bill 10. We must do something. And now we have brought forward a bill to actually solve that problem. And all of a sudden, they've changed their tones. Oh, no, don't do it. Wait till the next 6 months. Don't solve the people's problem. We are no longer interested in what Albertans think. That's no longer our concerns. Let's focus on these three things that we want that have nothing to do with the concerns of the people. And oftentimes, that is the distraction that we see from the members opposite. And I hope that as our Albertans who are tuning in tonight and paying close attention to Bill 66 and the argument or the comment from members opposite would know that this is all theater. Thank you, Mr. Speaker.
Thank you, Honourable Minister. I see the Honourable Member for Edmonton Riverview has risen to debate HA1.
Thank you very much, Mr. Speaker, and it's my pleasure to join the debate on the hoist amendment for Bill 66 so that it not now be read a second time and rather postponed for 6 months because certainly, although this bill does sort of fix some mistakes, and let's face it, there were some pretty significant overreaches by the government early in the pandemic that they have certainly publicly said that they did have an overreach, and they did make a mistake, and so they that's regarding Bill 10, and this is meant to mitigate some of the, I guess, troubles that bill that was passed in extremely quick order. Like, it was just 48 hours. The bill was passed. It was introduced on March 31st, 2020. And it was pushed through the Assembly in 48 hours. So this government at that time certainly felt that they needed to have these extraordinary powers, these powers that actually contradict what our Constitution in Canada says. But the government was adamant at that time, and despite certainly the very loud concerns of the official opposition and continually voting against Bill 10 at every level, at every reading, this bill was passed, Bill 10, and it was pushed through. So, you know, and all of us know that there was considerable outcry, really, in Alberta, and a lot of the, I would say, the folks who are part of the UCP themselves were very angry with this bill and the decisions that the government made at that time. Certainly, and it was described in the media as one of the most significant examples of executive power overreach in Canadian history. So although we were in a pandemic and we want to make sure governments do have the power to bring forward health measures, the things that they need, this bill kind of, went a bridge too far. And there was a lot of backlash, and the government certainly heard loud and clear, I think, that this legislation should not go ahead. And just for further evidence of that, in Section 92 of the Constitution, that lays out the exclusive powers of provincial legislatures, and there is no constitutional basis to assign new law-making authority to individual ministers. And so, of course, this is what Bill 10 did. Bill 10 did say that an individual minister behind closed doors, without the oversight of the legislature, certainly no one in the official opposition, they could write a complete bill, and it would not have to pass this chamber. And so, therefore, it could be done in silence. And, I'm quite proud of Albertans that they stood up and said, no, this is not okay. And, and this is an example, I think, where the government did listen. And I think that that is a good thing, and I commend them for that. But certainly it was a mistake they made. And this bill, 66, is meant to fix that. But I think that there's some significant missings in the bill that's supposed to fix it. And that's why we put forward this hoist amendment, so that it not now be read a second time. certainly, it was just a little bit over a month after the Bill 10 was introduced, and like I said, 48 hours after it was passed, that the Premier at that time admitted that, okay, you know, perhaps we have gone too far on this one, and this is a mistake. And so then the government put forward Motion 23 to create the committee to review the government's response to the COVID pandemic, as well as reviewing changes brought in through Bill 10. And so this committee that was created through this motion had 4 months to do a review. And their first meeting was back in June 24th, 2020. And at that time, the official opposition put forward several motions to invite experts to come to present to the committee, but the majority on that committee voted each of those down. And they put forward suggestions on focuses of the committee, like how can we look at the legislation before us that is of concern. Certainly the government did set up this committee so that they would be reviewing what had gone wrong previously. And so the committee was, keen to get at it. It was important work, and it was good the government had acknowledged the mistake they'd made in this legislation. But that's kind of all where it fell off the rails, unfortunately, Madam Speaker, because, the committee had a majority of UCP MLAs on it. And in that first meeting, they created a subcommittee that met off the record to determine the committee's work. And so this was a concern, because certainly we, as the official opposition, had, gotten involved with this committee in good faith. The government had admitted their mistake. There was concern about the response to COVID, and certainly the review of the Public Health Act. Like, how could we, as Albertans, work together collectively, as we have earlier tonight, as we did earlier tonight when we passed legislation that the Minister of Labour brought forward, so that Albertans can have, 3 hours off without being, afraid of being fired, losing pay, so they can get their vaccination. And I think that that's a really positive collective decision that we made here tonight, and I'm proud to have been able to vote on that and be part of that. And in the creation of this committee, we were hoping, of course, that the same thing would be true. But unfortunately, because of, in the very first meeting, there was this subcommittee created that really met off the record and determined the committee's work. And so the official opposition really had no influence on that. And as I said previously, all the motions to invite experts that we thought were key to being part of it were not allowed to come. They were not invited. And certainly the parameters that we saw, because it was supposed to be, certainly the Minister of Health even talked about how important this committee is, and that it is about looking at the Alberta Health Act plus Bill 10 and how we can best serve Albertans. And so it was disheartening for us to see that that was going to be tightly controlled by the government. It really wasn't, sincerely being engaged in, and it was really just sort of perhaps a political decision to say, we struck a committee, we're dealing with it, don't worry, Alberta. We heard you, there's a problem, we admitted to the problem, but now we're going to control it, and we're not going to be really fair, open, transparent about the whole process. So, this kind of flies in the face of some of the things that Minister of Health at the time said, indicating that he was looking forward to a comprehensive review of the Public Health Act and the government overreach of Bill 10, reviewing the government response to COVID. Like he said publicly, I have a quote here, that yes, absolutely, this is what the committee is going to be looking at. But yet that was all tightly controlled, and that did not actually happen, despite some of the, comments made by the Minister of Health in the public. Many Albertans will remember this. Dr. Hinshaw, of course, the Chief Medical Officer of Health, did attend once that committee, and a motion was put forward to have her attend again, and it was passed. But then later, in a subsequent meeting, the UCP caucus voted that down. So again, it was very tightly controlled as to who could come and speak to the committee, and how that was controlled. There was only 4 experts that were heard from. There was no review of the pandemic. So that is, certainly a much smaller mandate than what was understood originally, and certainly from the comments of the Minister of Health, kind of surprising that that there wasn't a more robust use of that committee process. There's also, significant delays. I mean, there was only a 4-month period of this work, but oftentimes there'd be like 3 weeks between a committee meeting, and then another delay again. And again, each time the UCP used their majority to control what went on in that meeting. Again, I spoke about that subcommittee that really, controlled the parameters of what went on. And, even though there had been an invitation, a second invitation given to the Chief Medical Officer of Health, that was rescinded subsequently in another meeting. So the control got tighter and tighter and tighter regarding this committee. And certainly, there were hundreds of Albertans who wrote into the committee to express their concerns about this overreach of government that, of course, Bill 10 had shown, this sort of really flagrant, flaunting of constitutional rule, and also, too, just concerned about the COVID-19 pandemic, the Public Health Act, how Albertans were being served during this very difficult time. So that's why I am, submitting to this House that we pass this hoist amendment so that this bill is not now read a second time, and it is postponed because there is still a significant amount that needs to be reviewed in this bill. And certainly there is a report that has been given by this committee that was struck with the motion the Premier put forward. But many of the recommendations, certainly of the official opposition, were ignored. And one of the recommendations was just the importance of public health care and improving health outcomes, equal access to health care services, making sure, it was supposed to be a review of the Public Health Act. This is kind of fundamental to healthcare. We want to make sure that all Albertans, regardless of position, regardless of income, regardless of where they live, that they all have equal access to healthcare, and they have support so that they have, the fundamental rights of healthcare in our province. But of course, this was voted down by the members of the committee, and so that was not part of the report that came forward, and certainly is not part of this bill at all. Another part of the official opposition recommendations was regarding the opioid crisis, which of course, as the critic for addictions and mental health, I've spoken about many times in this chamber. And so we wanted to make sure, as the official opposition, that the Public Health Act made sure the government had the powers and duties to ensure that people were supported, that were experiencing addiction issues. And you know, I'll say it again, Mr. Speaker, but we definitely have a pandemic, a COVID-19 pandemic, but we also have, an epidemic in terms of our opiate crisis here in our province. And it is heartbreaking, recent research that's come out is saying that 4 people a day are dying from opioid overdoses. And this is definitely a huge crisis. And so one of the things that the official opposition caucus put forward.
Thank you, honourable members. 29-2A is available, and the honourable member who caught my eye was the Honourable Minister of Justice and Solicitor General.
Thank you, Mr. Speaker. Mr. Speaker, we are dealing with important matters of public interest, and so it is critically important that every opportunity we have, that we set the record straight and focus, our folks, again, who are watching from home, focus their attention to the actual business before this particular assembly. I just wanted to quickly respond to, the member from Edmonton Riverview, in her commentary in support of the Hoist Amendment. Again, the thrust of her submission is that we should not approve this Bill 66 to move forward, but instead to postpone it to the next 6 months. A bill that seeks to address the concerns of Albertans, a bill that, an issue that led more than 600 Albertans to write into the Select Special Public Health Act Review Committee. And a committee in which the members from the NDP included their former Minister of Health, the member from Edmonton Glenora, include the critic on the health file, the member from Edmonton City Centre, amongst other members. And they had the opportunity in their report, to lay out what it is that they are recommending in a manner that addresses the concerns that led to the setup of the committee in the first place. That committee was set up pursuant to Motion 23 that was voted on before the floor of this assembly, in which members on the opposite side had the opportunity to weigh in. And we all spoke to why that committee was being set up. The record will show that in totality, it sought to address the concerns arising from Bill 10 and the concerns that have been flagged for us by the citizens of Alberta. The member from Edmonton Riverview would want us to believe that those concerns are no longer necessary. Just to be clear, this bill, Bill 66, if passed by this assembly, would, amongst other things, repeal sections of Bill 10, the Public Health Emergency Powers Amendment Act 2020, that authorizes the minister to modify legislation by order, something that the members opposite once again, accused members on this side of the aisle and the Minister of Health of being dictatorial, seeking maximum power to alter legislation by ministerial order. And this bill seeks to address that. And all of a sudden, the members opposite no longer wants that. Number two, this bill will affirm the right of individuals while maintaining the ability to respond to public health challenges. It will remove unnecessary powers to order immunization or conscription. It's something we heard clearly from Albertans that they did not want to. By the way, a provision that was part of the Public Health Act dating back to 1910, the 1900, something that this government was not responsible for, but for which the people of Alberta in 2020 raised concerns about. This bill will address that concern raised by the people of Alberta. This bill will improve transparency with clear checks and balances on authorities. It would require publishing orders that apply to the public health, to the public or groups. It will protect the right of patients with infectious diseases while containing the spread of disease. It would require periodic review to keep the Act current, Mr. Speaker. Thank you.
Thank you, Honourable Minister. I see the Honourable Member for St. Albert has risen on Hoist Amendment 1, HA1.
Thank you, Mr. Speaker. It's my pleasure to rise and speak to the Hoist Amendment. And interestingly, following the Minister of Justice, maybe I can set the record straight for him. We actually have not said, through you, Mr. Speaker, we've not said yes or no. We're talking about a Hoist Amendment, which means giving us a bit more time to do some other things. And what we're doing here tonight, Mr. Speaker, is called debate. And so we're talking about the pieces that we think are good. There aren't that many. And we're talking about the pieces that we have concerns about. And we're talking about the pieces that we think could be strengthened. Yeah. So I think it's a bit much for the minister, Mr. Speaker, to stand up and to attempt to lecture us for something he's attributing to us that he has no idea about how we're going to vote. So I'd suggest you pay attention to the debate. So anyway, what we're talking about is some of the things that this bill does. It undoes some of the damage that was done earlier during the pandemic. So we know that Bill 10, which was the Public Health Emergency Powers Amendment Act, really was essentially thought to be unconstitutional. You know, and I think we all tried to understand at the time where that came from, that there was genuine fear. I'm going to attribute genuine fear to the government, that they genuinely believed that the legislature could not meet safely. Clearly, that was a mistake. Going to give them a little bit of latitude. None of us knew what was happening or what was going to unfold, what was going to happen at the time. But I think very quickly, Albertans, as well as members of the opposition, we knew very clearly, very quickly, that this was a gross overreach. And then, you know, we also heard the minister, I think he announced in October that the government would repeal, and we know that that was done because of the pressure of the potential lawsuits or the lawsuit that was filed. So we know that the Alberta Court of Queen's Bench judge dismissed that court action. So anyway, we know that this bill isn't about promoting public health. It's mostly, once again, about cleaning up political messes of the UCP government. Now, we're pleased that it reverses the gross Bill 10 power grab, which prompted the lawsuit, as I mentioned, and, you know, somewhat of a party rebellion last year. So we're also pleased that it implements some of the amendments that the minister mentioned that we put forward during the last iteration of the Public Health Amendment Act, Bill 10. So, and that is that government and all members of the government caucus voted against, I would like to point out. So our amendment stated that in a democracy, it's incumbent on the government to make public health orders public. Now, in the digital world, I think that one of my colleagues already spoke about this. I think that we've all become accustomed very quickly to quickly going to our computers or our smartphones to find out what's going on, what the information is. And unfortunately, we have seen a real lapse or gap between what the government is saying, whether it's at a podium, whether it's the premier or a minister saying, you know, as of today, this is the new rule. This is how we're going to go forward. This is what we're going to do. But yet we were not seeing those orders in real time, digitally, for all Albertans to clearly access to understand what was going on. So that was not a good idea. And that was actually, that is something that really needs to be changed. I'm going to skip over some of this. So one of the things that I want to talk about that perhaps we haven't spent too much time on yet is the proposal to recover enforcement costs, which is in Bill 66. So now an individual or an organization who is found in violation of a public health order and is fined as a consequence will be subject to significant additional costs. Now, that's all well and good, and I understand, I certainly wasn't at the technical briefing, Mr. Speaker, but I understand that questions were raised at a technical briefing and using a real-time example, and I believe that was Grace Life Church. So I think all of us have seen over the course of the pandemic that one example that is a real glaring example of an organization that chose to defy public health orders. We all saw it on video of it, we saw it on social media, we saw it on the news, and then we saw all of the things that were happening as a result. Now, I'm not going to comment on that organization's choice to do what they did, and I'm not going to comment on law enforcement's reaction to that. But what I am going to comment on is that I believe that this government has set a very poor example for organizations to follow. And I would like to give you a few examples, Mr. Speaker. So we know very early on when we had the World Health Organization, we had leaders in Canada, in the United States, we had the CDC telling us that this was a very dangerous virus, that, all of the things they were telling us. And yet in this very chamber, we had the Premier of Alberta referring to it as influenza. Now, those words, those messages mean a lot. And by downplaying the severity of something that would go on to take the lives of hundreds and hundreds of thousands of people all over the world, to have a premier refer to it as influenza sends a very negative message. The other things that have happened, we're all well aware of, the COVID-18 from the government side that have elected to sign on to a letter to really downplay what is going on in this province, really what is going on in this country and around the world. And yet again, we see recently the member from Airdrie, talking about vaccine, really downplaying the importance of vaccine. Do your own research. Instead of relying on science, actual facts, do your own research. So that's not a good look. So the reason that I'm bringing these things up is that, it is one thing to enact legislation to add more teeth or the ability to do the things that this piece of legislation will do. But it's quite another to set up a scenario that you even need something like this. So we have a government that has the leader of this province, the premier of this province, I believe, has taken steps to downplay the severity of this virus. So I think, in the future, it's really important to think about the messages. Oh, yeah. I should have taken my cup out.
Sorry, Mr. Speaker, in 23HI&J, I don't think at any time the Premier has downplayed the severity of this pandemic, and that's a false one. Perfect. He has not downplayed it, Mr. Speaker, and I think she should retract that comment.
I see the honourable member for Edmonton South.
Mr. Speaker, I think that certainly we've seen the Premier even in this place recently call the pandemic an influenza pandemic or refer to COVID-19 as influenza, which we know it is not. Certainly, however, as you can see through this very thoughtful discussion between myself and the member for the Duke Beaumont here, this is obviously a matter of debate and not a point of order. Thank you.
The honourable members, at this stage, I'm prepared to order. I would find that this is not at this stage a point of order. It is a matter of debate, and I would ask that the honourable member for St. Albert please continue with 7.5 minutes remaining.
Thank you, Mr. Speaker. So as I was saying, I was talking about the government giving itself the authority to bill for the costs associated with the enforcement. Now, I am certainly not, making a straight line between the words that have been spoken in this place by the Premier or the actions of the COVID-18. I am not drawing a direct line between what organizations like Grace Life Church are choosing to do. However, I am saying that setting that tone, that sending that message is dangerous. So in any event, this piece of legislation, again, as I said, is giving them the authority, the government authority to bill for costs associated with that enforcement, costs of police, public health officers, their time, use of equipment, etc. So it would be, you know, I know that my colleagues have asked, in previous debates, have asked for answers, more information about what that will look like. What will the range be? We know that the current fine range can be anywhere from, say, $1,000 to $500,000. So what does that look like? What would this potentially look like for organizations? So the government is proposing to give themselves power to recover the costs from individuals and organizations for enforcing public health orders. That is a good thing, in their opinion, that they're having to recoup these costs. For example, in addition to paying a fine for breaking the public health orders, individuals can get billed for the cost to even generate that fine. So I talked a little bit about, you know, the example of Grace Life, which is very unfortunate. So here is my question. You know, I would be very curious, and I know that that I have had conversations with people about the situation with Grace Life, and I would be very interested to know what the cost of that enforcement is. I would also be, you know, I'm very curious about even, you know, the rallies that we've seen. We've seen them in Edmonton, we've seen them in Calgary. You know, we could probably spend some time talking about the other really sort of harmful elements that have gotten wrapped up with these rallies, whatever they're called, the freedom, anti-mask, anti-lockdown, whatever rallies they are. But again, I bring up these examples because I think that it is incumbent on the government to set a good example about the severity and seriousness of the virus. Now, I think that they have done a far better job lately to recognize the dangers, but in the early times of this virus, when we were all still learning what it meant for us, what it meant for our lives, that we saw a continuation of this government downplaying by the use of their words, which is very strange when you think about Bill 10. So on the one hand, you had leaders from the government side standing up, using words like influenza, and then introducing a bill that is essentially unconstitutional to give themselves all kinds of powers to pass legislation without consultation, without a sunset clause, because they were so concerned about the inability of the legislature to meet safely. You know, the two things don't make a lot of sense. They don't really, anyway, I won't go there. So while I agree that, you know, I am actually pleased to see that this government finally listened to the hundreds, I would suggest thousands of Albertans that have written in and talked about the very real concerns they had about Bill 10, not to mention the government friends who were prepared to take them to court, who were prepared to publicly distance themselves from this government. I am happy that they realize that. It is unfortunate, however, that it took that much pressure for them to do that. The other thing that this legislation does, it removes all sections in the Act that authorize a minister to modify legislation or create new legislation by ministerial order and at the sole discretion of the minister. So basically, essentially, they have entirely repealed Bill 10. Makes sense? That's a good thing. The legislation then went a step further and took away all ministerial discretion that existed before Bill 10. So officials argued that the pandemic has shown that the legislature can meet if needed, so the sections weren't needed. Removes powers to order. Okay, so I'm going to stop there. The other piece in this in Bill 66, sorry, I'm just going to skip that. Talks about mandatory immunization and/or conscription. So, you know, I'm not going to get into that too much. All I'm going to say about immunization tonight, I probably don't have much time at all left, is just to encourage every single person to go ahead and get immunized. So one of the, obviously there are some pieces that make sense, that are a cleanup job. I don't know, codifies in law that the Chief Medical Officer of Health must be a doctor. Absolutely makes sense. Allows for the possibility that physical absence from employment could be mitigated by working remotely. Absolutely makes sense. So this legislation adds obvious language that is generally accepted practice already or reflects the current world circumstances. Makes sense. I understand that there are some things that we couldn't have possibly known at the onset of this pandemic. Finally, I do want to say a little bit more about Bill 10. So the minister talked a lot about the fact that there was a committee established, and there was a majority report and a minority report, and talked about, some of the things that were recommended. But I think it's important to note that not all of the recommendations that were made by that committee are included in this piece of legislation. And in fact, there are some things that are included in this legislation that I don't think anyone even talked about. Nobody thought was important. But this is sort of a theme with this government, and I think back to just not that long ago, we were talking about Bill 65, now we're talking about Bill 66. And although there are some pieces I think that are timely and important, it seems like we're constantly having to come back here and just clean up and fix things that were done poorly. And at the time, we were telling the government, this is done poorly, you need to stop, you need to fix this.
Standing Order 29-2A is available. If anyone has a brief question or comment. Apologies, not entirely sure how the breakdown of 29-2A has happened over the past couple of hours, but the Honourable Minister Service Alberta did catch my eye first.
Well, thank you, Mr. Speaker. I wanted to just maybe address a couple of things that the member from St. Albert addressed in her comments. Particularly for starters about her comments about accusing the Premier of downplaying the severity of the pandemic. And one of her allegations is that he called it simply influenza. But what I'd like to point out to the member is what's on the Alberta government website that identifies that what an influenza pandemic is, or a worldwide flu, which is what occurs when a new strain of influenza virus emerges and spreads quickly around the world. People have little or no natural immunity, so large numbers of people may become ill. And these pandemics may occur 3 to 4 times each century. And so, we can look at the information that is on this website, which comes from, which highlights that an influenza pandemic is a technical term. It is the correct term, and it goes to highlight that there were a number of these in the last century, Mr. Speaker. There was the Spanish influenza. There was a couple of others, one in the 50s, one in the 60s, and then more recently there was the H1N1 pandemic in 2009. And so, what I'm trying to point out here is that the Premier never just called this simply a flu. He was pointing out the technical term that this is a pandemic. This is an influenza-based pandemic, similar to the others that the world has seen in the last 100 years. And so what other evidence can I offer, Mr. Speaker, that the Premier was not downplaying this pandemic? Well, when all of the talking heads and all of the medical community were dithering over whether PPE and masks would make a difference or be useful in this pandemic, the Premier was pointing to the fact that in a number of Asia-Pacific countries that have historically had stronger responses in dealing with these kinds of diseases, he pointed out that those countries have a much higher interest in using masks and PPE with the broader population. And so he suggested, hey, you know what, we should probably consider using this. And that is partly why Alberta led the country in terms of acquiring PPE, far in advance of any other jurisdiction, so much so, Mr. Speaker, that when other provinces were failing to supply sufficient amounts of PPE to their healthcare systems. Alberta was there to help them and supply them with the excess we had procured. This is because of the leadership of our Premier, it's because of the leadership of our Health Minister, and it's because of the diligent effort of our health officials who acknowledged and understood how important the risk of this pandemic was and took action early on. And that is why Alberta was a leader in the country. And we're able to support other jurisdictions. I'll maybe also just point out a couple of other things that could also support the fact that we have taken action to do better than other jurisdictions in the country. Let's look at Ontario, for example. There's a great column by Lauren Gunter that came out yesterday that highlights a sharp contrast in the fact that in Ontario, when you look at the hospitalization rates, Alberta is doing way better. When you look at the rate of ICU utilization, Alberta is doing way better. And when you look at the rate of deaths, Alberta is performing stronger. If you look at the 7-day average of deaths, comparing Ontario to Alberta, even after adjusting for population differences between the provinces, in Alberta we are roughly 2 times lower. And that is because we did a better job of how we rolled out vaccines to long-term care homes and to the elderly, most at-risk population. Quite frankly, Mr. Speaker, thanks to the leadership of our Premier, thanks to the leadership of our Health Minister, and thanks to the diligent work and expertise of our health officials, we did better than other provinces. And the numbers don't lie. The numbers support that. The evidence is in the numbers. So for the member opposite to be insinuating that the Premier was downplaying or has downplayed the risk and severity of this pandemic is laughable. And I'm proud of the work that we have done, and I am confident that once the vaccines have been rolled out, once all Albertans are protected, and once we see where we land relative to other jurisdictions across Canada and around the world, I'm confident that Alberta will be seen as having performed better than those other jurisdictions because of leadership and because of competent work of our diligent, hardworking health officials. So I'm proud of that track record, and I'll stand behind it.
Honourable members, that concludes the time allotted for Standing Order 29-2A. I see the Honourable Member for Edmonton Decore has risen to add to the debate.
Thank you, Mr. Speaker. Appreciate the opportunity this evening to add some comments. Maybe one of the first comments I will add that there's at least over 2,000 Alberta families that would disagree with the assessment from the Minister of Service Alberta on Premier's response and handling. So when I look at Bill 66, and of course more specifically the amendment HA1 that's before us to hit the pause button on this bill, there's 2 things that I want to focus in on around Bill 66. One, of course, is Bill 10, and the others is some changes that is very, very clear are new amendments that are being proposed. And so it's been interesting, as I've seen over the course of the 30th legislature, this government tends to put almost diametrically opposing legislation together in the same bill. So you end up having to face the decision of, well, do I vote against this thing and vote for this thing, or vice versa, and which one is going to be the the least worst thing that I can do. And so, based on some of the comments that I heard from the Minister of Justice about the opposition wanting to stall the removal of Bill 10, I would say, why has the government taken so long to repeal Bill 10? You've taken too long. You could have brought in a standalone piece of legislation. We probably could have passed it in, I don't know, half hour like we just did with Bill 71, because it was very, very clear from the start. I remember in the debate, Mr. Speaker, and I can't remember exactly what the wording was, but it was somewhere along the lines of in the legislation, if in the opinion of the minister it's in the best interest of Albertans, they can amend legislation, they can create new legislation, they can delete current legislation. And I warned right from the hop that that language was a problem. Because that's what I do. I get hung up on these things. I look for what could go sideways in language being presented sometimes. And that was so obvious. It wasn't even funny. Now, I'm very happy that the government has finally come around and said, maybe not specifically the member for Edmonton Decor, but yeah, you were right. That wasn't a great idea, and we need to get rid of that. So I'm pleased about that, because that was such an overreach. Unbelievable. It certainly has to go, but now here we come with the problem. Because also contained in Bill 66, which is now the reason why we have to hit the pause button, is all these changes. Now, I'm not necessarily saying that they could be a bad thing. I don't understand what the implications could be just yet. Okay? But it's clearly ideas that did not come out of the committee that was formed to look at this. So where these ideas came from, the public certainly didn't bring them forward. There wasn't necessarily organizations that brought them forward. The committee didn't even add anything in their report about that. And they've just showed up here in Bill 66. So here we have and I guess maybe I should go through a little bit of it here. The ability for government and AHS to recover the cost of enforcing public health orders. Now, there are some in this province that would likely suggest the government has done nothing to enforce public health orders up until maybe just recently. That's probably a debate for another time. There's a proposal now to recover enforcement costs on an individual or an organization who is found in violation of public health order and is fined as a consequence will be the subject to a significant additional cost. What are those costs? Have you determined what they are? Why didn't you put it in Bill 66? So here I am wondering, what's the implications of the lack of language being included? It's also giving the government giving itself the authority to bill them for all the associated costs. So costs for police, public health officers, their time, their use of equipment, what? What are you proposing? Nothing. So it's not a surprise that as the official opposition, we're proposing to push the pause button on Bill 66 and say, maybe we need to explore this just a little bit. I believe the favorite term, members of the government bench, members of the government caucus who served in the 29th legislature, used to always point out the unintended consequences. You always used to say, we're here to help. We're here to help the government avoid unintended consequences. Okay, I'm here to help avoid any unintended consequences. And you can do that by pushing the pause button. Maybe we could entertain then an amendment and separate out repealing Bill 10. We could always look at that. And pause on everything else. Perhaps then, as some of my colleagues have suggested over the course of the evening, maybe if we hadn't have pushed Bill 10 through in 48 hours, we would have avoided all of this. And of course, all the potential lawsuits that were lining up at the door. shortly afterwards. My God, it almost seemed like they were starting to take numbers before the bill even passed. That should have been a clue to hit the pause button at the time. And so it is a significant change in approach. And again, I'm not necessarily suggesting that it might be bad, but I also don't know if it might be good. So if we push the pause button here, we get a chance to explore these things. Perhaps the government might want to suggest, if it is so concerned about Bill 10 that it seems it took so long to get to this point about repealing, certainly could have brought in a standalone piece of legislation. I'd be willing to bet the opposition would have helped out in passing that and removing that. And give us the opportunity to look deeper into what this is doing. I remember there were several times, Mr. Speaker, in the 29th legislature, members opposite wanted to carve things up all the time. Well, let's just pull this piece out, and we'll vote on that. We'll help you right now, here and now. So maybe there's some things to look at around that. And so I am wondering about some of the cost implications around this. What kind of projections have the government come up with around that? Because it sounds like if you're going to be adding all of these costs, maybe you should be upfront with Albertans about what it might cost them if they're breaking public health orders. But of course, then that also comes doubling back to saying, well, then if the current deterrents you have are not doing it, maybe you should look at changing those before going here. I don't know if that has been thought about just yet, Mr. Speaker. Maybe we should be exploring that. Yet just another reason to push the pause button. I know my friend from Edmonton Gold Bar brought up some very, very good points with the Chief Medical Officer of Health. Maybe it's time we just simply solve what can and can't be done. I'm constantly seeing mixed messages coming, and it's no wonder people don't know. What's the right thing to do? What's the wrong thing to do? What's the safe thing to do? What's the unsafe thing to do? They're getting mixed messages. Got legislation that says the chief medical officer can do this, but then at one moment in time, well, I'm just an advisor. Which is it? So we're constantly getting conflicting information about what's going on. And so it's no wonder that people are having a hard time deciding what's best to do, what's safe to do. Not only their family members, but their neighbors. I am curious, though, as a member of the Private Members Committee, Mr. Speaker, we do have a private members bill that has now come back before the House talking about being more transparent by government on how it's, what it's doing when it's spending Albertans' money and accounting for those things. And, Mr. Speaker, you know me, I would never presuppose the decision of the House, but should that bill proceed, how potentially could that impact some of the changes that we're seeing proposed here in Bill 66 around cost recoveries? If that was subjected to the conditions being proposed in the private members bill, how does that influence things? And then if it does, and we're accounting for the time there, does the government then have to turn around and bill the individual that, or the organization that violated those costs as well? Have you thought about those implications? Here's a great idea. vote for the amendment to push the pause button, and we can explore those things. We can find out how these things will interact with one another. And then we can take it to Albertans and say, what do you think? Because I've heard time and time again how the government has said, we consulted, and then I phone a few people up and only didn't talk to us. Just be upfront with Albertans. I think, one of my colleagues here mentioned the level of mistrust they have currently right now with the government, and it's growing. And so if you're going to make statements about working hard to regain the trust, so obviously you seem to understand that there has been some loss. If you're going to work hard to regain the trust of Albertans, here's a great way to do it. We can push the pause button on Bill 66. We can get a chance to find out what the implications are. If you're that concerned about Bill 10, we can maybe quickly carve that out. I bet you we could come up with a way to make that happen and get that repealed right now. Well, maybe not right now, but you understand the idea. Although we moved pretty quickly this evening on Bill 71. I'm very proud of that. And I know the Minister of Labour worked very hard to get that legislation out, and I was very pleased to support it. I bet you we could work very, very hard to get Bill 10 out. I'd be very pleased to support repealing it. Despite the fact that, as I said earlier, it seemed like it took the whole government a very long time to get here to begin with. So when you talk about the official opposition stalling, I have to look at why the government took so long, knowing full well right from the beginning, even before it was passed, that it was going to be a very large problem. There's other aspects, of course, of the bill that I would be appreciative of maybe getting some answers on. We could get, that opportunity through pushing the pause button to explore that a little bit. It's likely not a problem.
Honourable Member, Standing Order 29-2A is available. I see the Honourable Member for Edmonton Gold Bar.
Thank you, Mr. Speaker. It's a pleasure to rise and offer a response to some of the comments that my friend from Edmonton Decor made in debate on this hoist amendment. One of the things that I want to respond to is the theme that my friend from Edmonton Decor hit on repeatedly was the mixed messages that we see the government sending through the enactment of these legislations that give them broad and sweeping powers, and yet their failure to enforce them meaningfully. It was interesting, Mr. Speaker, my friends and I had the opportunity to question officials from the Justice Ministry just last week at Public Accounts. And we had the opportunity to ask the Minister of Justice's officials about the policy with respect to enforcing public health orders. Because there is significant confusion as to who is responsible for enforcing the public health orders, which you wouldn't think would be the case, because the government is acted so quickly to give itself such broad powers to enact legislation without even coming to the floor of the legislature. The minister could amend or create any piece of legislation that he or she chose to do. And yet it seems that they didn't really make up their mind before they gave them those powers how they were going to enforce them once they had them. We asked the Minister of Justice's officials about who was the responsible organization for enforcing some of the public health measures that had been enacted under the public health emergency. And in some cases, it's Alberta Health Services, and in other cases, it's the police force, and in even other cases, it's a shared responsibility of those. And when we asked the minister's officials to provide us some clarity, the protocols are so extensive and complicated that they couldn't do it verbally. They had to commit to providing members of the committee in writing what those protocols were. Now, I appreciate that it's not a simple thing to enforce legislation, but when the enforcement powers are so divided and unclear, it makes it very challenging for enforcement authorities to enforce those legislation. So why did we need to enact this Bill 10 and then decide to clean up the mess when the government had no idea how they were going to enforce it, and to this day they still don't know how it's going to be enforced. And enforcement is only part of the equation, Mr. Speaker. It also takes the willingness to prosecute cases. Once a decision by the enforcement authorities has been made to charge somebody with violating the public health orders. And when we asked the Crown Prosecution Service what the prosecution standard was going to be, she couldn't give us a clear answer either. So, how is it that that Cabinet decided to give themselves these incredible powers to create any legislation that they so chose, just by fiat? They could do it just by ministerial order. And yet, once those were enacted, they had no plan for enforcing them. That's been the problem that my friend from Edmonton Decor identified with this government's mismanagement of the COVID pandemic all along. They had no idea what they were doing. They didn't understand. It's clear to us that they didn't understand the powers that they were giving themselves when they enacted Bill 10. That's why they're now repealing it here. It's quite clear that they didn't have any idea how they were going to enforce the powers that they were giving themselves. And that's why Albertans don't trust this government anymore with respect to managing the pandemic.
Honourable members, are there others wishing to speak to the amendment? The Honourable Member for Edmonton South has the call.
Thank you, Mr. Speaker. It's a pleasure to rise today and speak to the amendment to Bill 66, the Public Health Amendment Act. And Mr. Speaker, let me be very clear. We know that this bill is flawed in many fundamental ways. We know that this bill is not about promoting public health, and indeed it's about cleaning up the political mess that this government raised when they brought in the power grab that was Bill 10 at the beginning of the pandemic last year. So Mr. Speaker, I think that certainly as we look at this Hoist Amendment and we look at how we're moving forward with the public health rules in this pandemic and the responses from the consultation that was done by committee in this place, that really it doesn't make sense that we move forward with the legislation as written, and indeed we should accept this amendment. It's unfortunate, really, that the government, when they looked at these changes and they brought forward this piece of legislation, when they looked at the committee's work, they didn't take into consideration a single one of the suggestions of the official opposition's minority report. So, and Mr. Speaker, I think that's something that's quite unusual, because when we're talking about good legislative process, when we're talking about debate in this place, when we're talking about the work of committees and the work of the legislature, one of those core things that I guess you even teach to the grade 6 kids when they learn about our parliamentary system in school is that good debate and a variety of opinions leads to better legislation and leads to better laws for this place. And it turns out that basically none of the things that the opposition has talked about mattered to this government, and indeed, even some of the things that we identified specifically when the government originally brought in Bill 10 as their power grab, their unconstitutional power grab, at the beginning of the pandemic, some of those concerns that were raised were completely basically ignored. The concerns that the opposition brought forward were completely ignored. And Mr. Speaker, we instead see more power grabs. We instead see more authority being given to the government that wasn't considered by committee, that wasn't considered in terms of fulsome consultation. Things like the authority of the government to bill for the time associated with enforcement, which, as my honourable colleagues have spoken extensively to tonight, it's unclear the mechanism for this. It's unclear the extent to which this could be used, and indeed it would be a significant, substantive change to how we issue fines in Alberta, and really it doesn't really make sense because the government's been unable to satisfactorily explain how it aligns with existing fines anyways, right? So when we talk about these changes, when we talk about these substantive powers that the government is giving themselves to enforce public health orders, it doesn't make sense because we see that time and time again this government has failed to do their homework. They've failed to talk to Albertans. They've failed to debate in this place and listen to the consultations, and they failed to do the work that's required. So Mr. Speaker, I'm very optimistic that many of my colleagues, certainly at least from the opposition, will have more thoughts on this in the future, and we'll have more, I anticipate that we'll have many more amendments, as we don't believe that this legislation as written is a very strong piece of legislation. So Mr. Speaker, with that though, I anticipate that I would like to move to adjourn debate.
Honourable members, having heard the motion as proposed by the Honourable Member for Edmonton South to adjourn debate, all those in favour, please say aye. Aye. Any opposed, please say no. In my opinion, the ayes have it. That motion is carried and so ordered.
Under Government Bills and Orders for third reading, Bill 55, College of Alberta School Superintendents Act. Honourable Minister LaGrange.
The Honourable Minister of Education.
Thank you very much, Mr. Speaker. It is my honour to rise and move third reading of Bill 55, the College of Alberta School Superintendents Act. Bill 55 is about creating a professional organization for school system leaders to strengthen the kindergarten to grade 12 education system for all students. We did not embark on this journey alone, Mr. Speaker. In the fall of 2019, the College of Alberta School Superintendents, or CAS as they're known, submitted a proposal to my department to be recognized as a professional organization. We subsequently spoke to our education partners about options to make this possible. In summer of 2020, my department discussed this with key stakeholder groups, including CAS, the Alberta Teachers Association, the Alberta School Boards Association, and the Association of Alberta Public Charter Schools. We also engaged the Association of Independent Schools and Colleges in Alberta, the Association of School Business Officials of Alberta, and First Nations superintendents and education directors. Mr. Speaker, this bill is the result of that broad consultation and engagement with our education partners. If passed, this bill will result in CAS becoming a legislated organization. CAS would be responsible for setting professional learning requirements and offering professional development to its regulated members. Mr. Speaker, the important role that superintendents play in our education system has a significant impact on our students and our teachers. In making sure that every single student in our province receives a high-quality education, superintendents need to be held to a high level of oversight and integrity. That is what this bill delivers. Mr. Speaker, I was pleased to see the debate generated during Committee of the Whole. I'd like to take my time to recap some of the points raised during that debate and reiterate my responses to the House. First, members of the opposition expressed concerns with how the bill will define teacher leaders going forward. Mr. Speaker, my department's certification of teachers and teacher leaders regulation lays out a strong definition of teacher leader. Keeping the definition consistent in both the Act and in this regulation will better serve the education profession, which includes CAS and its members. Including the same definition from other regulations into this Act is key for us as we see value in being consistent across all pieces of legislation governing the education system. Second, the language in this bill that deals with funding mirrors that of the Teaching Profession Act. This provides consistency between Bill 55 and other pieces of legislation. This is also what the Alberta Teachers Association adheres to. Mr. Speaker, I also want to make it crystal clear in this House that Alberta's government does not provide membership fees for CAS. While there are grants provided for professional development and so on, they are similar to grants we have for the ATA and other education partners, including the Alberta School Councils Association and the Alberta School Boards Association. CAS, through its bylaws, will determine membership fees for regulated and non-regulated members and use these fees to fund its operations without additional support from my department. Lastly, with respect to the makeup of CAS, I again want to assure the House that the only mandatory regulated members under this bill will be superintendents and chief deputy superintendents, public, separate, francophone, and charter school boards or regional authorities. Other mandatory regulated members will be those eligible, and I emphasize the word eligible, central office teacher leaders who do not hold active membership in the ATA. Leadership within our education system is paramount. Superintendents are part of a system that also includes parents, teachers, principals, and trustees, all working together to achieve the best possible outcomes for students. Turning CAS into a legislated professional organization will strengthen the leadership and governance of school authorities at the highest level through Alberta. Doing so will ensure that students and school systems continue to be supported through improving governance, accountability, and leadership excellence. Mr. Speaker, when it comes to governance, the Act changes the structure of how CAS currently organizes its membership by creating two distinct categories, regulated and non-regulated. CAS is currently a voluntary organization of about 320 members, which includes superintendents from public, separate, and francophone school authorities, charter schools, and First Nations education directors. Other CAS members include assistant or deputy superintendents, directors, and other senior central office staff. As I've previously said, under Bill 55, membership in CAS will be a requirement for superintendents, chief deputy superintendents, including charter schools, and teacher leaders employed in central office positions in public, separate, and francophone schools and regional authorities who elect out of active membership in the Alberta Teachers Association. Under the Act, CAS will have bylaw-making powers to set additional levels of membership for non-regulated members. This may include system leaders in First Nations, school authorities, and independent schools, retired superintendents, or university professors, as an example. Moving on to accountability and leadership excellence, CAS will be required to hold an annual general meeting and to submit an annual report to this House each year. This is a matter of oversight for professional organizations and aligns with general principles of good governance and transparency cherished by this House. This bill also requires that the CAS Board of Directors include public members along with regulated and non-regulated members of the organization. Public members would be appointed by me as Minister for a fixed term, but only after consultation with CAS. Public member qualifications pardon me, and recruitment will be based on best practices similar to other agencies, boards, and commissions. Mr. Speaker, under the Act, CAS would be responsible for ensuring its regulated members are skilled and competent in their professional practice. This will be done by making CAS responsible for offering professional development to its regulated members and set learning requirements. Under Bill 55, CAS will be responsible for ensuring its members meet government's superintendent leadership quality standards and leadership quality standard, ensuring excellence. This legislation will have CAS oversee the professional discipline of its regulated members by addressing complaints of alleged unprofessional conduct and professional incompetence filed against its regulated members. Of course, CAS will still have to report information to me as the Minister of Education and the Registrar as required. That is not changing, Mr. Speaker. This simply shifts the responsibility for oversight of professional discipline matters from the Registrar at Alberta Education, who currently oversees professional discipline for these individuals, to CAS. Under this bill, the governance structure for professional discipline matters will resemble that of other legislated structures in Alberta, specifically the practice review of teachers and teacher leaders regulation. These regulations establish how complaints will be addressed in situations where the teacher or teacher leader is not subject to the Teaching Profession Act. As members can see, Bill 55 is a positive step forward for our education system, and it supports a highly professional set of leaders who are key to ensuring our students get the high-quality education they deserve. With that, Mr. Speaker, I look forward to my colleagues supporting Bill 55, the College of Alberta School Superintendents Act. Thank you.
Honourable members, are there others wishing to join the debate? The Honourable Member for Edmonton Whitemud, followed by Lac St. Anne Parkland.
Thank you, Mr. Speaker. It's a pleasure to rise in third reading of Bill 55, the College of Alberta School Superintendents Act. So I'd like to begin by thanking the thousands of school staff, the teachers, the EAs, the principals, the custodians, all of the people who are keeping our schools functioning either in person or online right now. It has been an extraordinary year for education in Alberta, across Canada, of course. Extraordinarily challenging, and we've seen school staff in particular rise to the challenge in a remarkable way. I say this, Mr. Speaker, as a parent of two elementary-aged children who is amazed every single day at the work that their teachers and their principal and so many others are doing every day. And so it is important, I think, when we talk about education right now, at any time that we're speaking about education, that we give our thanks. Because we also know that what happens this year in education is going to have long-term implications on our school system, on our children, on our teachers, and this has to be noted. So I'd like to express my personal thanks to all of those staff and superintendents and administrators at the school district level, associate superintendents, even school board trustees. Everybody has been doing remarkable work, so my thanks to all of them. And on that note, Mr. Speaker, I have to say with respect to Bill 55, I mean, I only began to touch on it there about how much is going on in education right now in Alberta. Tomorrow morning across Edmonton, tens of thousands of students will be moving online. We have seen students yo-yoing through online learning, in-person learning. This government continues to focus primarily just on case numbers, completely ignoring, as if many of them, I don't know, don't have children in school or haven't experienced this themselves, but I know they have. So I don't know how they can ignore the fact that even quarantining, close contacts, I know so many families whose children have been on multiple quarantines for weeks at a time. Again, they go back to school for a period of time and go back onto quarantine because of close contacts. We cannot ignore the impact of that on students, on their learning, on teachers, and that's been ongoing. We've seen absolutely no recognition of the impact of that on students, on teachers by this government. So when we talk about Bill 55, and we're not talking about these things, it concerns me, Mr. Speaker. It concerns me that we see ongoing denigration of teachers. And we talk about Bill 55 and how this is going to be transformational for the education system, but yet we have a government and a minister of education and a premier who continually denigrate the work of teachers. That has an impact on the education system. And we can't also ignore the long-term implications on our kids' learning because of what they've experienced this past year. So when I look at Bill 55, I think, how is this addressing the long-term implications? The kids who we know literacy skills have been affected. We know that fewer kids engaged in early learning, registering in pre-kindergarten and kindergarten, which will have long-term implications on their educational success and readiness for school. We know that children with disabilities have been completely abandoned by this government, firing EAs in the spring of last year, and they have not had the supports that they needed, and yet this bill is apparently going to be miraculously changing our education system. None of that is addressed by this minister. We hear almost nothing to address that when she talks about Bill 55. But of course, it doesn't address the budget cuts. And those superintendents, the ones who will be part of this college, will be making some very significant, difficult decisions. I know they already are. Cuts to their budget, cuts to PUF. I know that's already trickling down, and superintendents are working very hard to try to manage that right now. And then, of course, there's the curriculum, which also, the disaster of the curriculum right now, which, overwhelmingly, overwhelming criticism of that curriculum. But apparently Bill 55 is the hard work that this minister needs to bring forward to this legislature right now. Now listen, I'd like to say, I used to work within Alberta Education as a public servant for many years, and I know the great people who work in that ministry, people who work tirelessly to make the education system better. Frankly, I'm pretty sure many of them would have been very disappointed that during this critical years I just described in education in Alberta, they were supposedly devoting their efforts to drafting the very critical work of Bill 55, when I'm sure that they all believe there are more significant issues to address. But let me say, I gave all that as background because I simply cannot imagine, Mr. Speaker, that we are standing here in the year we've experienced in Alberta in education, that this was the top priority for the Minister of Education in terms of education legislation. This was the top priority. So, okay, now that's fine, here we are. Here we are, we're talking about Bill 55. And I have to say, I've also, along with having worked with Alberta Education for many years, I worked also many years directly with school boards and with superintendents. And I have nothing but the utmost respect for superintendents who I would speak to daily, who former teachers, of course, almost all, and they have to have that teaching background to be qualified to be a superintendent, passionate advocates for their staff, for their teachers, but most of all, of course, for their students and for their parents, though, as well. And so I appreciate the importance of superintendents and recognizing the good work that they do. And of course, because of that relationship that I'd had for many years directly with superintendents across Alberta, let me be clear, my clients that I used to work with, the school boards that I worked with, spanned from north to south, all the school boards all across this province, rural, Catholic, public, all of them, and Francophone as well. And I've reached out to a few of those superintendents, and obviously this isn't something, what we're seeing in Bill 55 is something they've supported and they've asked for, but it's also something that is probably not top priority for them right now. They said, fine, it's a good thing, they're happy about it, of course, and I can appreciate that, but that's not what was on top of mind for them. So I can only imagine those superintendents having meetings with the Minister of Education and being told, yeah, you'll get your professional college, which, that's nice, but they have really big, significant issues on their plates right now that this government has continued to ignore. So with respect to the amendment that my colleague, the member from Edmonton-Glenora, brought forward regarding bringing the definition of teacher leader, which is currently defined in the Certification of Teachers regulation, and bringing that into this act, I just heard the Minister of Education say that she wanted consistency. She wanted consistency between the act and the regulations. And that is precisely what the amendment brought forward by the member from Edmonton-Glenora was doing. It was precisely the same definition in the current regulation, but bringing it into this act, into this bill. So if consistency was the goal, I failed to have heard a reason from the Minister of Education as to why she would not have supported that amendment. because it was the exact same definition. The point is, the reason for the amendment was to bring it into the Act as opposed to leaving it to the regulation, because actually there was a small comment that the minister made in her comments on, or a small wording that the minister used in her comments on third reading, which I thought was very indicative. She said, "My certification of teachers regulation." And that is exactly the concern, Mr. Speaker. Instead of saying the certification, it's my certification of teachers regulation. And therein lies the concern. Because regulation, as we know, can be changed by a minister, go through a regulatory review process, but it's not debated. It's not subject to the scrutiny of this assembly. It's simply done by the minister's whim. And that is the concern, because the definition of teacher leader, while the minister assures us and has assured this assembly that it will not include principals or assistant principals, it's very easy for her to make that change anytime. She could do that through the regulation. That was the intent of putting it into the Act, was so that it could not be done that way, so that it does come to this House for debate and for scrutiny and for transparency. So that was a very simple amendment, and it seems to align with what the objectives of the Minister of Education is for consistency. But if there is a desire by the Minister of Education to not be consistent, then that would be why perhaps this government did not support the amendment. Because actually, they might want to change that definition of teacher leader, which would then mean, of course, that it could include somebody else. It could include principals. And then they would be subject to CAS membership, which means they could not be members of the ATA. And given the tone and given the way that this government approaches teachers and the ATA and their complete disdain, it's very clear that that could be an underlying motive, and that's exactly what we were trying to address. And by failing to accept that amendment, the minister made it clear that that perhaps is her objective. So on that note, Mr. Speaker, it's a little bit exhausting for myself as a parent of elementary school children, as a former lawyer for school boards, somebody who used to work within Alberta Education, the spouse of an assistant principal, that we have education legislation before us in this House in a time that could not be more critical for education in Alberta, and this is the legislation that this government has prioritized, but I also think it speaks clearly to who this government is. Thank you, Mr. Speaker.
Honourable members, are there others? The honourable member for Lac St. Anne Parkland.
Thank you, Mr. Speaker. And thanks, Minister, for bringing this forward. Sorry, I'm clearing my throat here a bit, folks, here tonight. I'm having an issue with the mask being on so tight here tonight. So for those members opposite that like to critique me clearing my throat and saying a bunch of other comments, that's okay. I can carry on with life here. So Bill 55, Minister, I just want to thank you for bringing this forward as a father of 4 kids, school-age kids. My oldest is in grade 11 this year. He went back during COVID and everything else. And my girls, they ended up staying home this year. They elected to homeschool. So that's the first time that we've done that. And some of the jabs you've been taking, Minister, having to deal with COVID, having to deal with everything else, and through you, Speaker, to the Minister, hats off to you for persevering on the platform commitments that we made, listening and truly consulting with the professionals that are out there that are educating our children and recognizing that. And, you know, for some of the stuff that you've taken from the members opposite, they haven't given you much credit where credit is due. And one thing I'm going to offer to you here is just an observation over the last couple of years. No wonder why they're so upset. They lost the best job that they never did. You're doing the job, you're taking care of business, and you're doing it for all the right reasons for our students and for the school divisions and for the curriculum, et cetera. So with that, my heartfelt thanks. And I'm going to share just a little bit of a personal observation as somebody who went to a small school division in a kindergarten, a grade 12 school that was only 360 people. And out in Knighton Junction at the time, we kind of had that, when I went to school, it was kind of one of those last stops for teachers that came from different areas or had been bounced around, or the very first stop for those new educators that came through. We had high turnover rates, we had low funding, we had tons of challenges, and the kid going through there, it was really a struggle to have that continuity. So now that I'm an elected member and I go out to Grand Trunk Yellowhead School Division, I can see the resurgence and the change in that school division and the way that they handle business. So hats off to Carolyn Lewis as a superintendent out there. Quite frankly, Minister, this lady was taking care of business before we showed up. One of the big things that I'd observed is their high test scores. So they had really good rates in their scores. One of the things that Carolyn had shared with me when I started drilling into it, again, my background was projects, so starting to look at things a bit differently. It was on cost. So she was maintaining to her principals to get their costs in order within the budgets that they were working with. So to make sure that if they didn't have the skill sets to do that, that there was training available through their controls person. She also put it back to those principals to be responsible for the budget and the test scores. They had to achieve both, and they had to meet it year over year. And that if the principals didn't meet those requirements, then maybe they weren't the right ones for the job. And all I've seen from that whole element there, they get a shiny gold star compared to some of the other jurisdictions that I tie in with. Not that they're bad, Minister and Speaker, to the Minister, but some are held to a higher level of standard and caliber. Now, if we can take that, and I think I mentioned that to some of my colleagues before, if we can take that whole idea and add that professionalism and some continuity to it, and through your Bill 55 of actually having the CAS, of having professional recognition in that, think of how many more impacts in lives that we can change. Think of how many more kids, especially in that rural Alberta context, where they can have those genuine opportunities, again, working within the budgets and the means, and reaching that high caliber performance. And then the principals themselves. The principals themselves are extremely engaged, and their staff is engaged because they have clear performance goals and criteria that come along with it, and the kids are benefiting. That is true, genuine engagement, and that's where I see some of the biggest benefits, Minister, of what you're looking at doing in Bill 55 and how it impacts all those schools and those kids out there. So with that, allowing me to digress a bit, and my colleagues here on the floor, I appreciate that, because it does have a big impact. And when these kids fire up in the new economy that we're creating, have the opportunity to work from home, we've seen some of the negative aspects of COVID, but we've also seen some of the advantages that these kids can have. I honestly believe what you're doing, listening to CAS, giving them their college, raising up those credentials, and allowing that line of sight will pay dividends, not only for the near term, but for the long term for our entire system. So thank you so much for that. So this act, what it'll do is allow the college superintendents or CAS to become a professional regulatory body. And that's important because, again, it strengthens the education of Alberta students by creating professional organizations and leaders. So, again, that credential recognition and letting them step outside of some of the teaching stream as well. Private sector experience and industry standards, the energy sector, that falls into it. Fulfills the desire of superintendents to have a professional organization. Again, there's something with that credence and credibility of being considered professional. Whether it seems like a small thing to some of us, but having that little shiny star, that accreditation, it does mean a lot out there. And to raise and achieve that level is not something to be taken away from. And again, if we can raise the caliber, raise the bar, and allow them to achieve that with their request, massive. It would allow for the creation of set standards which raises the bar of excellence in Alberta's education. Again, I talked about that in my own personal observations of bringing up the bar in those measures. Reduces red tape and provides the local autonomy of school authorities. Reducing red tape, of course, that's a platform commitment, and our Minister of Red Tape Reduction takes, similar hits in here too for doing a good job because no one else did it before, and they, folks opposite don't like that. Flexibility requires the neat ground on circumstances. So allowing them to actually deal with emerging challenges at hand that are unique to those school divisions or even potentially those schools themselves. So giving them that. Allows them to investigate conduct of competency matters. So again, using Carolyn, I hope she doesn't get too embarrassed when she may see this, using her as an example. She set the bar high and those expectations, made them very clear, gave them a timeline to achieve them, and then held them accountable. So accountability and responsibility for the budgets and performance. Before it was one or other or maybe none before, and there was a cultural change, but those principals, again, the ones that I ran into and the staff, they were encouraged by it. They literally looked at things different, and it reminded me of a high-performing project team. It was something to behold. I was pretty proud of that. Education is so important by making sure these set are involved, held accountable to the sets of those. The standards important to parents, personal perspective of the parents. So again, having that line of sight for the parents, having that ability to talk to them in there. Proposed legislation outlines CAS will not be involved in contract negotiations, will not play a union function for the superintendents. Proposed legislation explicitly clarifies superintendents must respect the authority of the board as their employer. Some that get entrenched for a number of years, and I know you were a trustee before, and Mr. Speaker, through the minister again, you can see how the elected sometimes are the ones that just pass through, and some of the superintendents that become entrenched also stagnate. And they have to understand that they are not the be-all, end-all, end-stop. They don't necessarily push the trustees around. The trustees are elected by the parents, by the people in those areas, and that's how it needs to be influenced. So this will allow that to ensure that that's still instilled, that they know who's who in the zoo, as it were. Proposed legislation explicitly clarifies the superintendents must respect. We went through that. Membership would be mandatory for superintendents and selected other educational system leaders. Most of the leaders could join as associate members. Again, giving the optionality for it, and to step outside of the norm, if you would, and to allow them to be part of something larger. Something larger meaning the context of that professional organization, which is absolutely wonderful. What else do we have here? Vital role, the educators. So again, really just happy to talk to this. Happy to see that all the challenges, that everything that have been happening over the last year, that this too, COVID shall pass. I know it's going to be hard for some folks to appreciate that. This will end. And everything you're doing is laying the foundations for that success, for having that line of sight and continuing to move the bar forward. Thank you so much for enduring all the things that you do to do that. Just trying to look at any other speaking notes here that I had, the key points in there. Proposed legislation outlines that CAS will not be involved in contract negotiations and will not play part of the union function of superintendents. So again, having that separation between the superintendents and the unions and making sure that that's clear, looking at it as the business model, making sure that you have that professionalism that they can pull together on it, setting the bar higher, and then having that college, or if you would, of that association to hold each other in higher esteem and higher regard. I think this is a winner. Thank you so much for bringing it forward, and I know that we're all going to benefit from it. So with that, Mr. Speaker, I'll close my remarks. Thank you.
Honourable member, Standing Order 29-2A is available. The Honourable Member for Peace River.
Well, thank you, Mr. Speaker, and I appreciate the speech from my colleague, the member from Laxana and Parkland, and I want to contrast it with the preceding speech from my colleague across the way on the other side of the aisle from Edmonton-Whitemud. And I appreciate that the member from Laxana and Parkland genuinely is trying to listen to parents, to stakeholders, to CAS, to the children themselves and what they need. And what we saw from the member opposite was sadly something that brought us to, I think, a lower level of debate. To be honest, Mr. Speaker, I would love to have intervened on the speech, but there were some procedural issues on Monday, so I haven't had the opportunity to. But I'm very happy to be getting the chance to speak now. And I just take issue with some of the things in contrast that the member from Edmonton-Whitemud said, compared to Laxton and Parkland, where he brought up the interest of CAS, that it is good legislation, listening to parents and children, whereas Edmonton-Whitemud seemed to imply the problem is the yo-yo of children going in and out of schools. Well, this government's proud to have taken a last and limited resort to restrictions to get as many children in schools for as long as we safely can keep them. By contrast, it seems the NDP and members opposite would have locked down schools immediately and kept them that way from the beginning. I think it's concerning also that as a former member of Alberta Education, she would somehow impute the bureaucratic intentions of her former colleagues, saying that those individuals.
The Honourable Member for Edmonton South.
Thank you, Mr. Speaker. On 23H, I, and J, the Honourable Member is obviously referring to the member from Edmonton-Whitemud and has made an allegation against that member of what she intended to say and how and what the motives she intended to apply upon the public servants that serve this place are. I would ask that the member withdraw those comments and apologize. I think that clearly it is something that is unbecoming of this House. Thank you.
The Government House Leader.
Mr. Speaker, there is no question that this is not a point of order. This is a matter of debate. What the honourable member from Peace River was saying is that somehow that member will impede, the intentions of our colleagues at Alberta Education. That clearly is a matter of debate, given the content of the incendiary remarks by the member from Edmonton-Whitemud with respect to the intentions of the Minister of Education and the priorities of this government and the Minister of Education. So there is nothing in the Standing Order 23 that would lead to the conclusion that that is a point of order, Mr. Speaker. So that certainly is a matter of debate.
Are you providing some additional context? Or?
simply adding the context that I intend only to honestly quote the member opposite and to debate the speech.
Are there others? I'm prepared to rule. I do agree that with the Deputy Government House Leader that this is a matter of debate. As it turns out, two versions of the facts can be present inside the Assembly, and we have to take the honourable member at his word. I do think that the more we can stick to the meat of the matter, the less likely these sort of personal offenses may be taken. The honourable member for Peace River.
Thank you, Mr. Speaker. And how much time do I have left?
3 minutes.
Thank you. And I will get to the meat of the matter, which is the previous speaker from Edmonton-Whitemud's comments, whatever they might be precisely, surrounding her former colleagues at Alberta Education. It's concerning if she is implying that they do not want to be doing the will of the minister in drafting this legislation. My understanding and my experience working with these professionals is that they have the utmost professionalism in how they approach this, and they would never try and imply to anyone that they don't want to do what has been lawfully asked of them in their responsibility in drafting legislation on behalf of the government that will be voted on in this House. And I think it's unfair for any member to accuse any or imply any one of those professionals who work in a bureaucracy would have any other intent. I think it's also concerning that the member opposite seems to only have a concern that we're opening and closing schools, doesn't seem to have any issue with the content of the legislation itself, but seems to be prolonging the debate. And I contrast that with my right honourable friend from Lexington Parkland, who wants to substantively speak to the content, wants to continue to move forward debate, and wants to implore the minister to continue doing the good work that she's doing. And I'd like to hear from the member from Lexington Parkland if he has any thoughts on how we could improve debate in the legislature and stay to this content, and his thoughts particularly on 55.
I think it is important that he provides his thoughts to 55. Perhaps if there's other debate about ways to improve debate in the legislature, that may take place on private members' business in a future Monday. I'm not entirely sure. The honourable member for Laxan and Parkland.
Yes, thank you, Mr. Speaker, and to my colleague who always is an inspiration. He speaks so eloquently. I'm rather rough and clumsy in comparison to him, and he represents his constituents very well and very passionately for the democratic process here, and I know he holds it in high esteem and high regard as we do here as well. And to the point of matter of Bill 55, one of the things that frightens, and this is an opinion, not a fact, it's just simply opinion, and obviously it will be a matter of debate. What frightens a lot of the opposition members, I believe, when it comes to new legislation and looking at a different way, it goes out of the context of their normal, their comfort zone. And again, there's folks that have a higher tolerance of risk or a higher tolerance for change. Some of these changes, they may think, detracts from what has been a very good system so far. But in my experience, when you have a good system, you always analyze and you tweak it and you change these go along and you see what the next steps are before you throw too many switches. Sometimes when individuals get scared, they tend to retract. They tend to go back into their holes, as it were. They're very scared to pop their heads out and take that risk or change. There was, I'd mentioned before in here, there was a little book or a little story that was called Who Moved My Cheese? And if I recommend the members opposite to really look at that, because there's a couple little characters in there, their names are him and ha, and because they're not adaptable to change, one does, the other one starves. But the ones that are willing to take the risk and change, they're all the better for it.
This is the time allotted for 29-2A. Are there any other members wishing to speak? Seeing none, I am prepared to call upon the minister to close debate should she choose to do so. The Honourable Minister of Education.
Thank you, Mr. Speaker. After more than a decade of the College of Alberta school superintendents looking for legislation that would allow them this opportunity to have their own profession, I'm happy to bring that forward and to close debate.
The Minister of Education has moved third reading of Bill 55, College of Alberta School Superintendents Act, All those in favor of the motion for third reading, please say aye. Aye. Any opposed, please say no. In my opinion, the ayes have it. That motion is carried and so ordered.
Bill 55, College of Alberta School Superintendents Act is now read a third time. Under Government Bills in Order for third reading, Bill 61, Vital Statistics Amendment Act 2021, Honourable Mr. Glubish.
Minister of Service, Alberta.
Well, thank you, Mr. Speaker, and I want to start by thanking all members of this Assembly from all sides of the House who have participated in debate on this bill so far and have collaborated to bring it to this point, being third reading. As you know, Mr. Speaker, things can get heated in the chamber, but I think on this bill we've had some really great and respectful dialogue back and forth. I believe there remain a handful of unanswered questions from members of the opposition from previous stages of the debate, and so I'd like to take the opportunity now to address those. First, the member for Edmonton-Glenora had referenced the story of the Greyhound killing, and I believe she had wondered if that perpetrator, Vince Lee, would be eligible under this legislation to change his name. And the answer, Mr. Speaker, is yes. People like Vince Lee who are found to be not criminally responsible are not convicted of a crime, and so they would still be able to legally change their names under this legislation. The member also asked about the reason for changing the wording around burial permit to disposition permit. And she was right in her supposition that the change is due to other means of interment. More and more people choose cremation when making arrangements for their own death or the death of a loved one. And even when cremation, or perhaps other methods in the future, even when cremation is chosen, those cremated remains are not always interred. So this is more all-encompassing language. Mr. Speaker, the member for Calgary-Buffalo asked about amendments around the place that an event occurs. And I would just clarify that there too, we are using more all-encompassing language. Currently, the Vital Statistics Act only recognizes cities, towns, villages, and hamlets when registering events such as births or weddings, and that includes areas under the Federal Indian Act, Métis settlements, and others. So this change comes as more and more Albertans request the ability to more accurately report where an event has taken place. And this is something I've heard about a lot at my office, Mr. Speaker, from folks all across the province. And so while we were addressing the issue of dangerous offender and long-term offender name changes and had this act open, we thought this was a great opportunity to give Albertans what they've been asking for. Another question from that member was around the wording of public bodies in Section 3D. And Mr. Speaker, this wording ensures that we are consistent with FOIP terminology and police or law enforcement agencies are called public bodies under that act. I just want to reiterate also that clarity in who is able and unable to legally change their names in Alberta is important for applicants or prospective applicants. The registrar is very knowledgeable and competent, and I have no concerns with the registrar's ability to carry out her job. On a related note, as far as I am aware, there has only been one incident in which the registrar denied a name change, and that was denied because the name included swear words and had an offensive meaning. There have been no denials in the last 11 years, and I believe, just the fact that there have not been denials does not mean that that the broader legislation is not needed. As I mentioned, we know simply because of the example of Mr. Leo Teske, who's a dangerous offender serving time in Edmonton, who, as I mentioned in earlier stages of debate, had sought a court order to do a publication ban on the fact that he was thinking of and intended to seek a legal change of name. That example alone demonstrates the need for this legislation. We should not allow even one of these dangerous offenders to have the opportunity to change their name and hide from their past and hide in our communities. I believe the last outstanding question was from the member of Edmonton-McClung, and it was a follow-up question related to the transgender community. As I said during Committee of the Whole, no law-abiding Albertan is affected by the changes proposed in this bill. But I do understand and appreciate that some Albertans, whether they are members of the transgender community or not, may find the process a bit daunting. And so let me just say, for clarity, that the process is the same for everyone, and fingerprinting has been a standard requirement since January of 2004. Mr. Speaker, Bill 61 does not introduce any new processes for individuals who are applying for a legal change of name. It simply adds an additional internal process where names are run through various databases to ensure that the applicant is not convicted or has not been convicted of one of the designated offenses under Bill 28 and is neither a dangerous, long-term, or high-risk offender. So I hope that that is helpful clarity for the member for Edmonton-McClung, who I believe was asking on behalf of folks that they had heard from. I will also highlight two other things, Mr. Speaker. First, I have checked with my department, and I have never received any feedback from transgendered individuals about fingerprint concerns for legal changes of name. And if there are folks that have concerns, I would encourage them to reach out to the Service Alberta Department, where they can receive additional information to put their minds at ease. Second, I want to remind all Albertans that legal changes of name are not published and haven't been published for several years. Mr. Speaker, I want to close by summing up what this bill does and why. Essentially, this bill expands on work that we did last summer with Bill 28 to close loopholes in the legal change of name process to ensure that these most violent criminals, the most dangerous and despicable folks in society, are not able to change their names and are not able to hide in our communities. We need to do this, Mr. Speaker, to make our communities safer. And that is why this legislation that we are talking about today will ban high-risk offenders as long as they're designated high risk. And also, it would ensure that there is a lifetime ban for dangerous offenders and long-term offenders. Mr. Speaker, I've said it before, but it is so important to reiterate that we know survivors, victims, and their families have to live with trauma for the rest of their lives. These convicted offenders who inflicted that trauma should have to live with the consequences of their actions and live under their own names for the rest of their lives. No hiding from their past, no hiding in our communities, and I think as the member from Edmonton, Glenora, said earlier, no hiding in the shadows, and I thought that was appropriate. So this is important legislation. It's important legislation that we are moving forward with in Alberta, I hope, at the conclusion of this third reading debate, that we will move forward with this. And it is important legislation that also requires a Canadian response. And so I will absolutely not rest until I have done everything in my power to encourage and equip my colleagues in every other province and territory in Canada to join us in implementing these same strong protections. Because all Canadian families deserve to feel safe. All Canadian communities should be safe from these violent criminals. And I believe that this legislation is an important first step, and that we can be leaders on the national scale to ensure that we can make all of those communities a little bit safer. And with that, Mr. Speaker, I'm so pleased to move third reading on the Vital Statistics Amendment Act of 2021. Thank you.
Honourable members, the Minister of Service Alberta has moved third reading of the Vital Statistics Amendment Act. Are there others wishing to join the debate? The Honourable Member for Edmonton, Highlands, Norwood.
Thank you, Mr. Speaker, and it's an honor to rise and speak to Bill 61. I'm going to be quite brief. I've not had a chance yet to speak to this bill, but noting the late or early hour, I will be brief. I want to first acknowledge the Minister. I truly do appreciate your comments on the transgender community, because that was something that was raised with me as well. And so truly, I can't claim to speak for the trans community, but I can certainly just appreciate that you looked into the issue and that you offered for folks to follow up with your department. So truly appreciate it, and I hope to see more support for the trans community from other members of your government. So I do thank you for that. And you know, we've made it very clear, just like I remember standing in this house to speak to Bill 28 as well, that absolutely we support the intent of this legislation, just like we did with that as well. we truly believe that we need to uplift the rights of survivors and victims. And I appreciated you mentioning that as well. But I cannot, you know, we're supportive of this bill, but I cannot leave this out of the debate. The fact is, this is a government that continues to speak about support for survivors, for victims, but I still think about it all the time, the folks that we heard from last year when this government decided to raid the Victims of Crime Fund. We heard firsthand from survivors of horrific crimes who pleaded with this government to not move forward with the cuts to Victims of Crime Fund, and they did so anyways. While we can't reverse that, not now anyways, I just want to get on the record again that this government moving forward needs to take the calls of survivors seriously, to hear from folks who experience traumatic sexual and physical assault and the hoops that they need to jump through, the therapy and the supports that are needed and that are so crucial, especially following such traumatizing actions. Again, I'm not going to continue to. Anyways, I won't. I've said this on the record multiple times, but it's very disheartening to hear a government say one thing and not support it. And I want to make one other point, and that's other supports for survivors. We've mentioned when we've talked about Bill 8, the human trafficking bill, and as well when we spoke to Bill 28. Without support for survivors, lots of these pieces of legislation are meaningless. And so when we're talking about supports for survivors, supports for people fleeing domestic violence as an example, housing, childcare, right? The need for wraparound supports. And so with that, Mr. Speaker, again, we are in support of this piece of legislation, but I want to urge this government moving forward to think about what tangible actions they're going to support that will truly help survivors and victims. Thank you.
Honourable members, are there others? Seeing none, I am prepared to call upon the Minister to close debate. The Minister of Service Alberta to close debate.
Well, thank you, Mr. Speaker, and I want to thank, again, everyone who participated in the debate on all sides of the chamber. I think it was a very respectful discussion, and it seems to me that there might actually be a consensus here, which is great news for Albertans. And I'm hopeful that we will have a good, positive result here tonight. I just want to say that this is one of many examples of how, as Minister of Service Alberta, I have sought to do everything I can within my portfolio, within my areas of responsibility, to solve a very real problem. And so I am the Minister of Service Alberta. I'm not the Minister of everything. I'm going to focus on the things that I have control over, that I have jurisdiction over, and I'm going to do the best of my ability to make Albertans' lives better, to make our communities safer, and I'm going to use all of the tools at my disposal. And it just so happens that the Vital Statistics Act is one of those tools that I have jurisdiction over, and that is why we are taking this important step here today to ensure that these dangerous criminals will never be able to change their names and hide from their past and hide in our communities. And we're doing that, Mr. Speaker, to protect Alberta families and to keep our communities safe. And with that, I'd like to move to close debate.
Members, the Minister of Service Alberta has moved third reading of Bill 61, Vital Statistics Amendment Act 2021. All those in favor of the motion for third reading, please say aye. Aye. Any opposed, please say no. In my opinion, the ayes have it. That motion is carried and so ordered.
Bill 61, Vital Statistics Amendment Act 2021 is now read a third time.
Deputy Government House Leader.
Thank you so much, Mr. Speaker, and thank you to the honourable members of this Assembly on both sides of the aisle for a job well done today. We've had opportunity since this afternoon, Mr. Speaker, to debate and passed some very good pieces of legislation, and I am thankful to all members of the Assembly. Mr. Speaker, with that, Mr. Speaker, I move that the Assembly be adjourned until 1:30 p.m. on Thursday, April 22nd, 2021.
Members, having heard the motion from the Deputy Government House Leader, all those in favor, please say aye. Aye. Any opposed, please say no. In my opinion, the ayes have it. That motion is carried and so ordered. The House stands adjourned until tomorrow at 1:30 p.m.